A very warm welcome to all the scholars and delegates who joined with us for the online paper presentation of Tadvidya Sambhasha Parishat 2026. The theme of this year, Pata Avabodha Anusthana, the path to practice, reminds us that ultimate goal of studying the Shastras is their successful application in healing. Now, it's my honor to welcome our distinguished panel of judges. Dr. Santrupti Katti ma'am, Associate Professor, Department of Kaya Chikitsa, Mahaganapati Ayurveda Medical College and Hospital, Dharwad. Dr. Abhishekar Gone sir, Professor and Head of the Department, Rachana Sharira, Vice Principal, Rashmi Institute of Ayurveda Medical Sciences, Kudligi. Dr. Usha Rani Sanu ma'am, Associate Professor, Department of Samhita Siddhanta, Shri BMK Ayurveda Medical College, Shahapur, Belagavi. Dr. Aisha Mullah ma'am, Associate Professor and Head of the Department, Kaumara Bhritya, Ayurveda Mahavidyalaya, Hubballi. Without any further delay, we'll start the session. Now, the rules of the session will be to ensure the smooth conduct of the session. I request the participants to follow these simple rules. Each presenter has 5 minutes for the presentation, and this will be followed by 2 minutes for a discussion and question answer session with our judges. We request all the participants to be mindful of their time to respect this schedule. And let us begin the presentations. I now invite our first presenter, Dr. Sandhya Dwivedi.
Good morning, ma'am. Good morning, everybody and judges there. Today's topic of my presentation is impact of diabetes mellitus on sugar on male patients and integrative Ayurvedic and clinical perspective under the guidance of Dr. Shekhar UK sir, Assistant Professor in All India Institute of Ayurveda. Contents, introduction, methodology, data collection analysis, discussion and conclusion. Introduction. Prameh, a metabolic disorder described in Ayurveda, is primarily associated with kapha dosh, meth, and clay, leading to the vitiation of multiple dhatus, including shukra dhatu, reproductive tissue. India is currently experiencing a major diabetes epidemic with over 100 million adults affected and approximately 136 million individuals in pre-diabetic stage, representing an
I'm sorry to interrupt, Dr.
adult
Sandhya.
prevalence of around 10.5%.
Please keep your video on while
Yes, ma'am.
presenting.
Okay, ma'am. Sorry.
I request all the participants to please keep their video on while presenting. Yeah, you can continue now.
ICD-11 defines diabetes mellitus as a chronic metabolic disorder characterized by persistent hyperglycemia due to inadequate insulin secretion or impaired insulin utilization. Methodology, study setting, Department of Priya Sharir, All India Institute of Ayurveda, New Delhi, data collected during OPD, study population, total 5 patients diagnosed with type 2 diabetes mellitus, inclusion criteria, age 18 to 60 years, diagnosed diabetes mellitus type 2 more than for 6 months, HbA1c more than 6%, willing for semen analysis, exclusion criteria, known infertility due to non-diabetic causes, chronic systemic illness unrelated to diabetes, long-term corticosteroid, chemotherapy or radiation therapy. Data collection, demographic, age and occupation, diabetes related, duration of diabetes, current medication, HbA1c within 3 months of semen testing, lifestyle, smoking, alcohol units per week, exercise, occupational exposures, Ayurvedic assessment, Prakriti, Dhatu evaluation, focusing on Shuk, subjective and objective parameters, laboratory semen analysis performed after 2 to 7 days abstinence, processed per WHO manual, parameters recorded, volume, pH, sperm concentration, total sperm count, progressive motility, total motility, morphology, normal forms, method used, vitality. Case details. Case 1, age 21 years, HbA1c 8.9, sperm count 20.6 million per ml, 28.4% volume normal. Key findings, severe acidozoospermia. Case 2, age 52, 7.2 HbA1c, sperm count 70 millions per ml, motility slightly sluggish, 2.5 ml volume, early functional impairment. Case 3, 35 years, 7% HbA1c, 20 millions per ml, 10 motility 10%, volume 1.4 ml. Key findings: hypospermia plus asthenospermia. Case 4, age 35 years, HbA1c 7.1, sperm count 30 millions per ml, motility 10%, 1.8 ml volume. Key findings: severe motility defect. Case 5, age 51 years, HbA1c 6.2, sperm count 6 millions per ml, motility 20%, volume 1.1 ml. Key findings: oligo plus astheno plus hypospermia. Ayurvedic correlation. Case 1 telling severe mortality, reduced severe mortality. Ayurvedic interpretation: snigdha and sar gun kshay. Case number 2, mild mortality, decreased early snigdha hani. Case 3, low volume plus decreased mortality, uh, bahal plus pichal and sar dushti. Case 4, mortality reduced, Ayurvedic interpretation sar plus snigdha gun kshay. Case 5, low sperm count, volume and mortality decreased, Bahal Gun Guru and Snigdh Pichil Gunshai. Discussion. Classical Ayurvedic literature recognizes Pramhe as Mahagar due to its chronic nature, complexity, and involvement of multiple entities in the body. Among the affected dushyas, Shukra holds a unique position as it is the final and most refined product of Dhatu, Parinam, making it specially susceptible to long-standing metabolic derangements, particularly those seen in metabolic diseases. The present descriptive cases attempted to assess the qualitative and quantitative status of Shukra Dhatu in male patients with type 2 diabetes mellitus. A dual approach was used, combining Ayurvedic clinical assessment and modern semen analysis. The findings were correlated with glycemic status measured by HbA1c. Sperm motility and SARS-Snigdha Gunshai. Case 1 shows severe asthenospermia. Case 3 and 4 severe motility defect despite normal count, indicate functional impairment before structural loss. Semen volume related with Bahal Guru Gunsh. Reduced semen volume observed in case 3 and case 5 indicates Bahal Gunshai, reduced Bal, Guru Gunshai, reduced stability. Liquefaction time, Pichil Gun and Agni Dushti. Delayed liquefaction seen in case 3, 4 and 5 indicating enzymatic dysfunction, oxidative stress. In Ayurvedic terms, Pichil Gun Dushti and Shuk Dhatvagnir impairment. Integrative interpretation. The findings clearly demonstrated diabetes primarily impairs the functional guna of Shukra, like motility and liquefaction, before causing gross quantitative decline. Modern semen parameters such as motility, volume, and liquefaction time can be effectively mapped to Ayurvedic concept of Shukra, Bal, Pravritti, and Gun Sampat, validating the classical description of Shukrasha in Prameh. Conclusion. This descriptive study demonstrated that type 2 diabetes mellitus significantly affects Shukra, predominantly by impairing its functional goods such as Snigdha, Sar, Pichal, and Bahal. Poor glycemic control is closely associated with deterioration of sperm motility and liquefaction, while long-standing diabetes leads to irreversible quantitative decline, manifesting as oligospermia and hypospermia. An integrative evaluation combining Ayurvedic assessment with modern semen analysis provided a deeper understanding of male reproductive dysfunction and diabetes. Early identification of Shukra Gunshai offers a therapeutic window for timely intervention aimed at metabolic correction, Agni restoration, and Shukra Vardhan, potentially preventing progression to irreversible infertility. These are the references. Thank you.
Can you please show me the slide of that gas detail? Yeah. Next slide, please. So, reduced motility, you are saying that Snigdha Guna Rasa. How can you
Yes.
interpret that motility with the Snigdhata?
सर उसकी जो उसके शुद्ध शुक्र के जो लक्षण बताए हैं, अगर हम देखें तो स्निग्ध गुण जो है उसकी मोबिलिटी के लिए कॉज करता है, जो उसकी स्मूथ पैसेज देता है मोबिलाइज करने के लिए। इसलिए सर मैंने स्निग्ध लिया है मोर्टेलिटी के उसमें शय में, कि उसका गुण का ह्रास हो रहा है, इसलिए उसकी मोर्टेलिटी शायद रिड्यूस हो रही है।
I'm asking that the motility means the movement.
यस सर।
Either the snigdhata, it will enhances the pravartana or vega pravartana of that sperm.
सर स्निग्ध प्लस सार गुण इज आल्सो अफेक्टेड इन दैट सर, जो मैंने
Saraguna,
ऑलरेडी।
I can find that Saraguna Kshaya is what you have made interpretation, that is good. I'm asking about Snigdhata. Snigdhata means it is a unctuousness. It is a guna of kapha, right?
यस सर।
So you please interpret that Snigdhata will decreases the motility. How can you will interpret this? And again in the second case, mild motility, early Snigdhahani you are said.
सर मैंने
Low volume, that is Bahala. Low motility, that is again Pichila. Sara Dushti, I can understand that Saraguna is holds good for the moment. Can you interpret that Snigdhata and Pichilata? And you said that the low volume, that is Bahala. Bahala in terms of quantity or else in terms of quality of that Shukra. Because whenever you are interpreting the gunas with the gametes, either it may be the Shukra or it may be the ovum, try to understand first the complete morphology of the sperm, so that the every structure of that sperm or ovum you can correlate with the Mahabhutas first. After when you are correlating with the Mahabhutas, you start to compare with the gunas. So I am asking, however, your case presentation is good. And as coming to the introduction slide and discussion slide, and even though in the conclusion slide also, you have typed all the things. You just make a flowchart manner, or else you just keep the images so that you can explain everything. You are just simply reading the things. So that's why I'm asking the question that how can this snigdhata or pichilata, it will enhance the motility? Because these two gunas are the Prithvi Mahabhutas, derivative of the Kapha doshas. Kapha will not enhance the motility. Vata will enhances the motility. Whatever the tail it is there of the sperm, that itself it is having a movement. That itself it is having a Vayu Mahabhuta. And you said that go to the next slide, please. Somewhere you have made that Agni Dushti, where it is.
सर इन यस सर दिस इन दिस वन।
Liquefaction time, Pichila Guna and Agni Dushti. Can you elaborate this?
सर लिक्विफेक्शन टाइम जो है उसका जो मैं समझ सकते हैं कि अगर हम जब उसका एनालिसिस करते हैं सीमेंट एनालिसिस, तो लिक्विफेक्शन टाइम है कि उसका जो थिक पार्ट है वो सेटल डाउन कितनी देर में होता है। तो इसीलिए अगर उसकी अग्नि दुष्ट है या शुक्र धातु मतलब शुक्र अग्नि धातु अग्नि इम्पेयर्ड है तो उस पर सेटल डाउन।
How can you judge that Shukra Agni Dushti?
सर शुक्र के फॉर्मेशन मतलब शुक्र के फॉर्मेशन में मेनली शुक्र धात्वग्नि ही मतलब जब धात्वग्नि जो मेंशन किए गए हैं तो उसमें शुक्र धात्वग्नि अगर इम्पेयर होगी तो शुक्र फॉर्मेशन में दिक्कत हो सकती है ना, इस वजह से मैंने इसको ऐसे
Shukra formation either only in the liquefaction.
सॉरी सर।
Either only in the liquefaction.
नो सर।
Agni Dushti can make the less liquefaction or more liquefaction only in terms of the liquefaction that the Shukra Agni Dushti will make, or else the complete formation, or else the motility, or else the specific gravity, or else the volume, or else the motility. Sarve roge api mandagno.
Yes.
Even survey rogyapi mandagno, if it is there, the concept being a kaya chikitsa. So when the survey rogyapi mandagno is there means not only the liquefaction time you can compare with the Agni Dushti. Either it may be the Shukra Agni, that is it may be the Dhatva Agni, or it may be the Bhuta Agni, whatever. The volume also requires the Agni. The specific gravity will also require the Agni because every cells require the Agni proper, right? Again, you can interpret that liquefaction time is only the Agni Dushti. How cannot you cannot interpret that seven volume will not require any Agni Dushti? So before presenting any topic, you try to please make over the things that whatever may be the questions they may ask the however the case is good, no problem in that. You made well, but try to keep the slides are empty with good images. And when you are commanding, will you have a command on the topic? Do not write anything on the slide, right? Thank you.
Dr. Sandhya? Yeah, Dr. Sandhya? Does I just wanted to ask you whether Snigdha Guna affects the motility or Pichila Guna affects the motility or both?
I guess both.
That shouldn't be a guessing mark, right?
Both.
Yeah, can you go to slide 10? So, do you have any idea what is the liquefaction time for normal semen analysis in a normal semen analysis according to WHO? Do you have any idea?
I do not remember, but during मतलब एनालाइज करते वक्त मैंने जो रिपोर्ट्स देखी थी उसमें उसके अकॉर्डिंगली था, बट मैंने याद नहीं किया मतलब उसकी नॉर्मल वैल्यू.
ओके, ठीक है. तो अगर टाइम पता नहीं है तो कौन सा गुना ज्यादा बढ़ गया है, कैसे तुम हाउ विल यू कम टू अ कंक्लूजन, इजंट इट?
मैम वो जब मैं मतलब मैंने ऐसे याद नहीं किया था, बट मैंने उसके जो रिपोर्ट्स के हिसाब से ना उनके अकॉर्डिंगली देख के वो किया था, एनालाइज किया था. बट आई डू नॉट रिमेम्बर द नंबर. यस, आई एम सॉरी फॉर दैट.
ओके, ठीक है, ठीक है. एंड go to slide 8. 8. Can you go to slide 8, Sandhya? So now you told me that Pichila Guna and Snigdha Guna both gets affected in motility factor. But here in the first severe motility, you have just mentioned Snigdha and Saraguna.
Saraguna, yes ma'am.
That you just clear it off, okay?
Yes ma'am, yes ma'am.
Thank you.
Madam, what is the importance of correlating this again with diabetic patients? Because without diabetes also, you get all these lakshanas. So why did you give importance to diabetes here?
I'm not able to hear you clearly.
Can you hear me now?
Yes ma'am, a bit clear.
Okay. You have correlated this case with diabetic patients, am I right?
Yes ma'am.
Yeah. So what made you to think about diabetic patients?
Yes ma'am, actually ma'am, I had worked with CCRS in their project. There I had one symptom read in the history of diabetes, loss of libido. And meanwhile, while I was practicing in OPDs before joining PG, I also overcame with the patient suffering from sexual dysfunction, especially in diabetic patient. And इन उसमें डायबिटीज जो प्रमेह के जो लक्षण बताए हैं, सॉरी दूष्य बताए हैं, उसमें भी शुक्र दृष्टि जो है लास्ट को बताया हुआ, इसलिए मैंने डायबिटीज और शुक्र का कोरिलेशन देखने के लिए ट्राई किया था.
तो आपको आपने HbA1c के वैल्यूज दिखाए है ना?
हाँ जी सर मैम.
तो मैम आपको क्या क्रॉस मतलब क्या कोरिलेशन दिखा शुक्र दृष्टि एंड HbA1c को आप कैसे रिलेट करोगे?
मैम जितनी ज़्यादा हाइपरग्लाइसेमिक इंडेक्स था उसमें ये सीमेन के उसमें रिपोर्ट्स में डिफरेंस मिल रहा था पहले, लेकिन मतलब स्पर्म काउंट शायद नॉर्मल रहे होंगे, लेकिन उनके जो बाकी फीचर्स हैं मोर्टेलिटी और मॉर्फोलॉजी वगैरह वो सब इफेक्ट हो रही थी.
ओके.
Hello. Is- Hello.
हाँ जी मैम.
Is it audible? संध्या.
यस मैम. यस मैम.
हाँ, तो आपने प्रमेह को लेकर ये शुक्र दृष्टि का जो ये किया है, so whether you have got any like mental health issues in that
नो मैम.
शुक्र क्षय कंडीशन?
नहीं मैम.
मतलब मानसिक विकारास का कुछ उसमें ये दिखा है आपको, जो भी आपने जो केस डिटेल्स का स्लाइड आप ओपन कीजिए. Whatever the HbA1c you have shown, you have taken the 18 to 60 years of age group, isn't it?
यस मैम.
So how could be it possible? Just open that slide. Case details.
Actually, I am not sharing the screen.
अब शेयर हो गया ना, तो just open it. So whatever you have taken, the age group that is 29, 52, 35, 35 and 51. So in those cases, like the 52 and 51 years, so in that both cases, have you added any like, or have you seen any mental health issues
No ma'am. No mental issues related with them.
related to Shukra Kshaya?
Yes ma'am. None of them.
क्योंकि प्रमेय में भी बोला गया है और इसमें भी बोला गया है उसको वन ऑफ द निदान फैक्टर बोल के.
यस मैम. बट जो मैंने पेशेंट्स एवेलुएट किए थे उनमें नहीं था ऐसा. वो मेरे पास बेसिकली सिर्फ यही कंप्लेन लेकर आए थे कि दे आर नॉट एबल टू परफॉर्म द सेक्सुअल एक्टिविटीज, और मतलब पहले दे वर एबल टू, बट नाउ दे आर काइंड ऑफ डिप्राइविंग ऑफ दैट. तो यही था उनका मेन कंप्लेन. बट स्ट्रेस रिलेटेड उनका कोई ऐसी हिस्ट्री थी
What
नहीं.
is the exact age of? Okay, what is the exact age of Vajikarana?
ये जो बाजी मैम जिसमें मैं समझी नहीं मैम.
मतलब वाजीकरण द्रव्य देने के लिए एग्जैक्ट एज क्या रहती है?
अप टू 60 years मैम.
Okay, thank you.
Thank you, Dr. Sanjay.
Next participant, Dr. Vaibhav Vittal Kumbar.
Please mention the time taken by the presenter. First presenter time taken, please.
Okay, sir. Okay, Vaibhav, you can start now.
Namaste, respected judges. I am Dr. Vaibhav. Today I am here to present my topic entitled as an exploratory case control study to assess the association between fifth house Rahu placement and early pregnancy loss with reference to Pishachi Jata Harini. Coming to the introduction, early pregnancy loss is defined as a spontaneous loss of pregnancy before 12 weeks of gestation. Etiological factor, there are multiple etiological factor like genetic abnormality, endocrine dysfunction, uterine abnormality, environmental and lifestyle factor, but a subset of early pregnancy loss remains unexplained despite clinical evaluation. As per Jyotisha, birth chart is composed of 12 house and the fifth house is associated with progeny, and Rahu is traditionally described as associated with irregular or adverse outcome. In Ayurveda, early pregnancy loss can be correlated with Jata Harini, particularly Pishachi, described in Kashyap Samhita. Limitation scientific evidence evaluates such a traditional concept using modern epidemiological methods. Coming to the astrological background, Kundli is are of two types basically, Lagna Kundli and Chalita. Lagna is a planetary position at the time of birth divided into 12 house, that is a bhava, and the fifth house is associated with the progeny and the reproduction. Rahu is traditionally linked with the irregular or adverse outcome. So here study focuses assessment of Rahu in the fifth house in relation to early pregnancy loss. Coming to the aims and objective, aim was to study the relationship between Rahu placement in fifth house, that is Putra Bhava, and the early pregnancy loss. And the objective was to assess the association of Rahu placement in the fifth house with early pregnancy loss and to explore its correlation with the Ayurvedic concept of Jata Harini. Coming to the methodology part of the study, study design, exploratory analytical case control study was chosen. Study setting, gynecological outpatient, inpatient department, All India Institute of Ayurveda. Sample size, 132 couples was selected, and out of which case was 66 and control was 66. Study population, that is case, is a couple with history of early pregnancy loss, that is less than or equal to 12 weeks of gestation, and the control is a couple with successful first and the subsequent full term deliveries. Coming to the inclusion and exclusion criteria for case, history of early pregnancy loss, that is less than or equal to 12 weeks, and idiopathic, that is no known cause of identified, and accurate birth detail available and willingness to participate. For control, successful first and subsequent full-term deliveries, accurate birth detail available, and the willingness to participate. Exclusion criteria, known cause of pregnancy loss, that is chromosomal abnormalities, uterine abnormalities, severe endocrine disorder, and incomplete birth detail was excluded. Patient screening, for case, initially 180 patient was screened, and 114 was excluded, and 66 was included as a case. In control, for control, 120 was screened initially, 54 was excluded, and 66 was included as a control. Detailed clinical and reproductive history recorded under the data collection, and etiological screening for known medical cause was done, and birth detail, that is date, time, place, was collected for the preparation of Lagna Kundali. Lagna Kundali were prepared using standardized validated Jyotisha software, and the assessment of Rahu placement in the fifth house was done. Observation and result, 132 couples was included, out of 66 was case and 66 was control. Rahu in the fifth house, out of 44 cases, 66.7% cases shows presence of Rahu in the Kundali, and in control, 27.3 shows presence of Rahu. Statistical finding, chi-square x equal to 20.56 at degree of freedom 1, odds ratio equals to 5.33 at 95% confidence interval ranging from 2.52 to 11.14, indicate significantly higher prevalence of Rahu in the fifth house was observed among cases compared to the control. Statistical analysis, data presentation, categorical data expressed as a frequency and percentage. Taste of association assessed using chi-square x test. Measures of association, strength of association association, that is odds ratio, with set p-value less than 0.05. Coming to the discussion part of the study, the observed findings suggest a potential association between fifth house Rahu placement and an increased likelihood of early pregnancy loss. This may be interpreted in light of Jyotisha, where Putra Bhava governs the progeny and Rahu is linked with the disruption and irregularity. The absence of adverse outcome in control despite Rahu placement may be influenced by the dynamic nature of Antaradasha, which can be modified or mitigate planetary effect over time. The occurrence of early pregnancy loss in case without Rahu in Putra Bhava also suggests the role of other Graha influences, that is Antardasha variation, or underlying biological factor indicating multifactorial causation. The finding may support the classical concept of Jataharini, particularly Pishachini Jataharini, described in the Kashak Samhita, with Rahu placement reflecting subtle influence in the Garbhanasha. The study design support the observed association. However, interpretation must consider observational limitation, possible confounder, and reliance on the accurate birth detail. Coming to the conclusion part of this study, the study indicates a significant association between fifth house Rahu and early pregnancy loss, aligning with the Jyotisha concept of Putra Bhava and Rahu's disruptive influence on the reproductive outcome. The observation may also interpreted as a supporting the Ayurvedic concept of Jataharini, with Rahu placement reflecting subtle factor associated with the Garbhanasha. However, the presence of case without Rahu influence and the unaffected control highlights the role of Dasha, Antardasha, other Graha influences, and the biomedical factors, suggesting multifactorial causation. These are the references. Thank you.
Okay. The time taken by the participant is 6 minutes. Now the session is open for discussion. I request the judges for any questions. Dr. Abhishek sir.
Why you selected this topic?
Sir, actually, my friend is more interested in astrology. He is actually my roommate. Sometime we go to discussion with on this topic, and we came across this condition, like the presence of Rahu in the Putra Bhava may leads to adverse outcome of progeny. So in my family and my friend's family also have some cases like first and second pregnancy loss. So we go the Kundali assessment, and we got same condition in the Kundali. So we started more cases evaluation and got more interest in this study. So I conducted this study.
Okay. Have you seen the Kundali of only the pregnant women?
No, sir. It is actually a retrospective study. Those who have a first or second pregnancy loss, we choose them as a case.
No, I am asking only the Kundali of that pregnant lady you have seen, or else the father who belongs.
No, sir. Actually, we select a case as a couple. So we had go through a couple, the both Kundali of couple, father and mother also.
You have excluded some cases. Idea behind to exclude them?
Sir, known cause of pregnancy loss, we were excluded.
So what are the cases in that the fifth house Rahu is there? You have selected that case only particularly, right?
Not getting, sir.
In the cases where in the fifth house, if the Rahu, if he is not compatible, only that case you have selected, right?
No, sir. We selected those who had lost first or second pregnancy, and then after we evaluated position of Rahu in the Putra Bhava, that is Putra fifth house.
Only the Rahu is responsible for this.
Yeah, sir. Rahuli actually in classic explained as a disruptive nature. So there are multiple bhava in the Lagna Kundali, like Putra bhava. So Rahu may disrupt any kind of house. So as Rahu present in the Putra bhava, it will leads to adverse outcome in Putra bhava.
What the insight you can say regarding that Chandra?
Chandra, sir, Chandra is having a Soumya bhava, so it it cannot act as a disruptive nature or any other adverse effect.
No. Moon it directly affects over the Rasadhatu, right? Because it is a Saumya Guna,
Yes,
right?
sir.
And the Rasadhatu, Upadhatu, your Artava is there.
Yes, sir.
Your Jupiter, that will affect the Shukra Dhatu, total reproductive tissue.
Yes, sir.
And your Mars, that will affect over the Rakta Dhatu. And the Shani, it will makes the Vata imbalance. That's
Yes, sir.
what Ashtanga Hridayakara has says, Gate Purani Rajasi Nave Avastite Shuddhe Garbhasyashe Bijatmana Ragadi Karma Swakarmacha Uditena Jivena Abhisrashtasham Garbhashyam Upayati. See, whatever the things they have done in early life too, the Shukra, it will deliver the things what he has conducted, the deeds. So those will also be carried out through the sperm, and some of the things they are already stuck in the female reproductive system also. That will also make the effect. Not only the fifth bhava, you are concentrated on the fifth bhava only. Moon is also responsible, Jupiter is also responsible, Mars is also responsible, Shani is also responsible. If the Artava Kshaya, if it is there, means the Moon and Jupiter weakness, it will be there. So failure to sustain the fetus, whenever the failure to sustain the fetus, it is because of the Artava Kshaya, that is Moon and Jupiter weakness it is. And that Rakta Dushti, that is because of the Mars, that will leads to the bleeding mainly. And Vata aggravation, that is instability of the Garbha, it is due to the instability of the Shani. So not only blindly belonging over the Kundali, some of the things that will be what I said, Nave Avastite Shuddhe Garbhasya Ashe Bija Atmana. So Swakarmacha Uditena. So the things what the both the couples they will do, that will carry it out. Even though in the Kashyap also he has explained the same. Kaman Mithuna Sanyoge Shuddha Shukra Shonita. Only the Shuddha Shukra and Shonita will not be required here. Kaman Mithuna Sanyoge. The curse of the love of the God, that is Mithuna, is also required. Kama, the desire, is also required. The desire is from both the couples. So desire will also makes a big impact. Curse of the God is will also makes an impact. Your fifth Baha, that Rahu, will also make an impact. Moon will also makes an impact. Jupiter will also makes an impact. Mars will also makes an impact. Even though your Shani will also makes an impact, and even the Guru also. So what are the things after assessing? Okay, leave it. In the fifth Bhava you assessed. So what the things you have explained to the patients to carry it out?
Sir, can you please repeat question?
You have said that in the fifth bhava, that is specially about the what you call that Rahu. What are the things you have explained? According to the Kundali, you assessed that in the fifth there is a problem. So, what are the things you have explained to the couples to do to come over that?
Sir, actually, as you explained previously, every graha have a impact, as you explained. In our cases, there are some cases who have first and second abortion, or second abortion, but they don't have a Rahu placement in the Putra Bhava. But there is one concept called Antardasha. That means the state of Lagna Kundli also varies according to the Kala, Dasha and Antardasha.
Yes.
So,
Okay.
we can consult to the inform to the patient couple or we can guide for pregnancy, like looking at the dasha and antardasha of that particular couple. So it may overcome the condition. Like in cases of like in control also, there are some there are some couples who have a Rahu placement in the Putra Bhava, but they did not have any adverse effect of Rahu. So we can think in like that way.
I'm not asking that. I'm asking the question. If Shani, if it is a problem, we usually say that you have a Shani problem, you just go to the temple of Anjaneya Swami. Like that, we will explain to anyone.
Okay.
So, what are the things you have explained where the Putra dosha is there, or else where due to Rahu Prabhava there is a miscarriage? What are the things you have explained to the patient to do to come over that issue with that issue?
Uh, Actually, sir, I am aware about only that Rahu and disruptive nature in fifth house. I'm not. I don't have any detailed knowledge about treatment perspective of this.
So you are only said that even though in the fifth house, if the Rahu, if it is good, if he is there in his own place, that's what I
Yes.
said early. Not only the Rahu, it will makes an impact over the developing embryo. The Guru is also required. If Guru Bala, if it is good, if Shani, if he is good, if Mars is good, if Jupiter is good, so all the grahas will makes an impact, not only the Rahu. Anyhow, thank you. Good topic.
Yes, sir. Actually, every graha have impact, but the Rahu is having a disruptive nature. So Rahu only affect the progeny as a disruptive. It's his disruptive nature. So it affect the pregnancy outcome only.
Okay, okay.
Thank you, sir.
Yes, Dr. Vaibha.
Yes, ma'am.
Yeah. Actually, first of all, a nice selection of the topic. And what I would like to ask is whether this pregnancy loss was, did you assess whether this Rahu's position was during the conception time or after the pregnancy loss?
No,
His
ma'am.
placement.
Actually, Kundali are of two type: Lagna Kundali and Chalita. Chalita is just changeable, and the Lagna Kundali is a planetary position at time of birth. So it is a constant. So we assist those who had lost first or second pregnancy. Those we assist them their Kundali.
Okay. Have you considered any age criteria?
No,
Age.
ma'am. We did not have considered any age criteria. We selected a case those who have first and second pregnancy loss.
Okay. ठीक है.
Dr. Aisha, ma'am.
First of all, I congratulate. It's a good topic. So, have you considered any unhygiene conditions of this, or I should say, what the sir had told, the Artva Dushti conditions, that is considered as one of the causative factors according to Kashyapa Samhita for this Jata Harini. So, have you considered that factor in this?
No, ma'am. Actually,
Shruti.
it is. Yes, ma'am. Yes, ma'am.
Hmm.
Ma'am, actually, it is a retrospective study, as it is a retrospective study. So we had assessed only any etiological factor according to available medical history, and only we had go through Rahu placement in the Putra Bhava. We
Because
did
that
not
is
assess
the main
any.
positive factors.
Uh, Yes, ma'am. It is, as it is a retrospective study, so we are unable to do that, and we have assessed only the clinical history.
Okay. So have you considered any age group particular?
No, ma'am. We did not had considered any age group. Those who have first and second pregnancy loss, we included as a case.
Because whatever we see in practical, we consider about 30 years of age group, they are considered as the high risk pregnancies. Okay.
Yes.
So have you seen any cases of like that getting of more abortions about 30 years, or within what I should say within 30 years it is considered as there is no abortion or safe, like that?
Yes, ma'am. I actually did not mention here age group as you asked,
But your
but
observation?
my observation suggests, according to the cases I included, there is no any significant observation like that.
Okay.
Like
And hmm, hmm.
like increased age associated with the adverse outcome. There is no any kind of
But
such. But the most of cases, ma'am, are below 30.
are below 30.
Yes, ma'am.
Okay.
Considering maternal age, ma'am.
Okay. But how you will correlate that below 30 the Jata Harini effect will be more?
No, I'm not saying like that
Yeah.
below 30 Jataharani effect
Huh.
is more. Actually,
Huh.
I did not consider any age and any other factor correlation.
Depending upon Kundali, you are saying that below 30 years age, this effect is more.
No, ma'am, I am not
Hmm?
considering age as a factor. I'm just
Okay.
looking at Rahu placement and the disruptive nature on the Putra Bhava. So the first and second pregnancy get affected as adverse outcome.
So in one slide you have explained that other grahas, but other grahas means which other grahas you are exactly want to say?
Like ma'am, Guru has its nature to increase as it is in Ucha Sthiti, it
Okay.
increase the good condition. So if there is a Guru, it will leads to positive outcome, and it overcome with the Rahu's disruptive nature. So the like in control, we have some cases those who have a Rahu, but they did not have adverse outcome as a first or second pregnancy loss. They have healthy progeny.
Oh, thank you.
Thank you, ma'am.
Hello.
Dr. Usha, ma'am.
Yeah. What was your sample size? Just list out. What was your sample size?
Ma'am, 66 in case and 66 in control, 132 patients.
Okay. So in control studies, they were not having any such astrological problems.
Sorry, ma'am, you are not audible.
In control studies, did not have any such Kundali problems.
Yes, ma'am. Some patient have this Kundali problem, but as I explained previously, due to Dasha or Antardasha, the patient did not control did not get adverse outcome as a disruptive nature of Rahu's on for Putra Bhava.
Okay. So in the other group, you saw the disruptive effects.
Yes, in cases it is more as compared to control.
Okay. So I think you went for a questionnaire development to take the survey.
No, ma'am. We just had assist Rahu placement in Putra Bhava, those patient who had first and second pregnancy loss. We did not had any questionnaire development. We had go through detailed clinical history, which is available.
Okay. Okay, fine. Good presentation, doctor.
Thank you, ma'am.
Okay, I thank Dr. Vaibhav. And our next participant is Dr. Ashwini Bidnal.
Good morning, everyone. Myself, Dr. Ashwini Bidnal, second year PG scholar, SJGMC Ayurvedic Medical College and Hospital, Koppal. Today's my presentation topic is Fundamental Dynamics of Vata Dosha, a classical perspective from Vata Kalakalya, guided by Dr. Parmeshwar GH, Professor and HOD, Department of Kriya Sharira. These are my contents. Introduction. Vata is considered the fundamental governing force of the body. It is described as the Yantradhara and Tantradhara. Tantra is a Tantram Shariram. Tantra is the body and the Yantra is the instrument. When the systems or a Tantra is also we can take as the systems, digestive system, CVS, CNS, when they work properly, means the organs present in that system should work properly. That is governed by the Vata dosha only. Next. Classical background. This is taken from the Charaka Sutra Sthanas, 12th chapter, Vatakala Kalyam Adhyayam, and the shloka goes like this: Vayus Tantra Yantra Daraha, Pranodana Samana Vana Apanatma, Pravartaka Chestranam, Ucha Vachananam, Niyanta Pranita Chamanasaha, Sarvendriyanam Udyojakaha, Sarvendriyartanam Abhivoda, Sarva Sharira Dhatu Vivhakaraha, Sandanakaraha Sharirasya, Pravartako Vachaha, Prakrutihi Spasha Shabdayoho, Shrota Spashanyor Moolam, Harshotsahayor Yoni, Samirano Agnehe, दोष संशोषणः क्षेप्ता बहिर्मलानां सोलान् श्रोतसां वेत्ता कर्ता गर्भाकृतीनाम् आयुषो अनुरुति प्रत्ययभूतो भवत्य कुपिताः. Next. Sensory and motor functions. Pravartaka Chestranam, Ucha Avachananam initiates all body activities. Chesta is here Ucha Avachananam and Vividanam Atava Shubha Ashubha functions. Activities is of various kinds, like high activities, higher and lower, diverse, or even good or bad functions is also done by the Vata only. Sarvendriyanam Udyojaka activates sense and motor organs. Here in Gangadharji in commentary he written Udyota Udyojaka instead of Udyotaka. Udyojaka is nothing, means a coordinator, and Udyota is used as the expander. For example, head must move and eyes watch the scene of an action taking place around. The two movements as well as the work of visualizing is the coordinated effort of coordinated effort to gain the knowledge is gain the knowledge. Vata which brings about these two coordination, and Sarvendriya Arthanam Abhivoda carries a sensory information. Here Vata is the carrier of the objects of Indriyas, Shabda is the object of Shrotendriya, and Prakriti is Spasha Shabdayoho. When we go to the Panchamahabhutas, bhutas and their gunas, Akasha is having Shabda, and Vayu is having Shabda and Sparsha. Teja is having Shabda, Sparsha and Rupa. Here goes like this. Here Vata is having Shabda and Sparsha both. And Shrota Sparshanyor Moolam. Vata is the Moola for the Shrotanendriya and Sparshanendriya. Physiological roles. Pranodana Samanavana Apanatmanaha. In simple words, it is the soul of the Pancha Pranas. Pranavata governs the respiration, Udana for speech, Samana for the digestion, Vana for the circulation, and Apana for the excretion. These five types of Vatas coordinates all systemic activities. And when we comes to the structural functions, Sarva Dhatu Sharira Vivhakaraha Sandhanakaraha Sharirasya. Vata governs a body tissue through Dhatu Vivhakara. It maintains a structure of a tissue, organs, and body, and maintains a shape, maintains a structure integrity through Sandhanakara that holds the cells, tissues, organs together. And normal Vata maintains structural harmony, preserves the shape, size, and shapes and shapes of the body parts, and supports connecting the body tissues like ligaments, tendons, and ligaments and tendons, and regulates the growth, and it also uh, aging process. And vitiated vata leads to the loss of cohesion, that is abnormal growth and tumors. Psychological function, Niyanta Pranita cha Manasa. Charaka describes Vata as the controller of mental activity and emotions. That is, it acts as the controller of the Manas when it moves towards the undesirable objects, and as the guide when it moves towards the desired objects. Harshotsahayor Yoni. Balanced Vata ensures joy, energy, and courage. Imbalance leads to the mental disturbance, fear, and abnormal behaviors. Next. Metabolic and excretory role. Samirano Agni. It stimulates Agni and supports the digestion, drives metabolic and tissue formation. For example, if a dry heap of grass is collected and ignited, it will take some time to burn it. But when the wind is blow, it will burn very fast. In the same manner, Vata present in our body ignites the Agni. And Kshepta Bahirmalanam. It regulates excretion at all levels, like cells, intestine, kidneys, and skin. Imbalance of Vata leads to the toxic accumulation and disease. For example, uric acid accumulation leads to the gout. Next. Special functions like Karta Garbha Krutinam, role in embryogenesis. Vata shapes a fetus from conception itself. Imbalance may cause a defect. Chakrapani, in Chakrapani commentary, he also explains about improper functioning of Vata, like Garbhan iti vikrutin apadayati atikalam dharayati. Means when the Vata is abnormal, it leads to the congenital defects in the fetus, and also it delays the labor. Ayushu Amruti Pratyabhutu Bhavita Kupitaha. Vata supports life and body functions. Normal Vata ensures longevity, and disturbance can cause premature death and diseases. Discussion and conclusion. Discussion. Vata governs vital life process, including movement, sensory motor functions, mental activities, digestion, and development. Modern physiology partly relates Vata to the nervous and endocrine system, but no single system explains all its functions. It may represent a combined regulatory mechanism, neurohormonal integration, rather than a single psychological entity. Conclusion. Vata cannot be directly equated with any one modern physiological structure. It reflects a holistic functional principle integrating multiple body systems. Further research in integrated physiology is needed to better correlate Vata with modern science. Where Vata moves, function exists. Where it ceases, life ends. Thank you.
The time taken by the participant is 7 minutes 50 seconds. And the session is open for discussion. I request the judges to have any questions.
Go to the last slide, please. Last but one. Can you name what are the vital life processes, please?
So vital life processes like inspiration, expiration, like respiration, cardiovascular activity, it may be, or uh,
You cannot say it may be. I'm asking, what are the
yes,
life
sir.
processes? There are 7 vital life processes are there.
Yes, sir.
What are those?
Um, Respiration,
Yes.
that is pranavata is responsible for the respiration, and
Hmm.
circulation, we can take, sir, like vanavata is responsible for the circulation, that heart pumps the blood and it circulate all over the body, and rasadhatu is also circulate all over the body is by the help of vanavata,
Hmm.
and excretory also.
Okay. Next 4.
And mm,
Nutrition, respiration, excretion, sensitivity, movement, reproduction, and growth. These are the 7 life vital processes, right? So
yes,
for
sir.
nutrition, your prana, not only prana, your samana vata is also required. For respiration, prana and udana is required. For
Yes.
excretion, apana and samana is required. And for sensitivity, that itself it is a karma of the vata. No other any panchavatas are required. That is itself it is a quality of the vata, sensitivity. For movement, your vanavata is required. And for your reproduction, prana is also required and even apana also required. And for growth, dhatu vyuhakara function of that vata is required. Can you elaborate the vyuhana karma?
Vyuhana karma, sir. Dhatu Viva is that is body tissues, how that organizes, sir. Means rasa dhatu, rakta dhatu, and the structure also we can take, sir. Cells to tissues, tissues to organ. There is a proper development is there, sir, in our body. If there any defect in that process, that may leads to the abnormal growths like tumors. For example, multiple cell divisions if takes, then it may be carcino, it leads to the carcinoma, like tumors, abnormal growths we can see, sir. There should be some limitations or restriction to
So
that
you are saying that vyuhana karma is nothing but the organizing.
organizing. Yes, sir.
Now, the 7 life vital processes what I have explained now, that is the organizer. Vyuhana means it is a managerial. The vata works as a manager because to analyze the evolution of a metamorphosis of the dhatus and the organization, the differentiation and the development of all the body tissues is done by the vayu, and that should be through the vyuhana karma only. Here vyuhana means it indicates the war of the state in which groups are arranged in a particular order to face the dreadful opponent. So that is the vyuhana karma, because the different types of the dhatus are utilized to face the dreadful opponent. So as your fight and flight relax function, those all comes under the vyuhana. So vyuhana means it is not a organizer, it is a managerial. So can you explain vata is a speaker?
uh, yes, sir.
Because you have said that pravartaka cheshtanam uchchavacha.
Ucha avachananam.
Hmm.
Yes, sir. Here, chesta is nothing but any activity. So it may be like shubha, ashubha, anything,
Hmm.
and
No. Pravartaka cheshtanam uchchavachanam.
pravat.
Will
Yes,
you
sir. Ucha
elaborate it?
means the greater, avacha means the lower one, or the both are having opposite actions, sir. Flexion, extension, it may be.
No. It is in relation with the speech only it is explained pravartaka cheshtanam uchchavanam, because in Kundalini Yoga there are stages of the sound they have explained. Para, Pachanti, uh, Madhyama and Vaikhari it is there. So that para wise, it is a celebration that comes from the gnostic area, that is from the posterior part of the temporal lobe it will come. Pashyanti means it will comes from the vernix area. It has to come from the interpretation of the compiled meaning it will come. And Madhyama, it is from the Broca's area and the speech. And Vaikhari, that is the phase of the articulation and resonance. So, whatever the quality of the speech it is there, of course it is from the Vata only, because it is a Pravartaka Cheshtanam and Uchchavachanam, as it is explained in the Vata Kalakali there. So Vata that has to move through the Dhamanis. So can you name the Dhamanis which are responsible? Because he has explained Cheshtanam Uchchavachanam. So Uchchavachanam means, as in consideration, you just take the two types of the sound. One is very much loud, one is very much medium one. So from where these space of the articulation for the loud sound and from the mild sound? Are you getting my question?
No, sir.
Presenter? Hello?
Hello, sir.
Are you getting my question?
No, sir.
So that in if you conclude this Vata as what I have explained, it is a organizer, it is a managerial, the speaker I have explained, right? Can you explain the Vata as a coordinator? Can you explain the Vata as a basal metabolizer? Can you explain that Vata is a synergistic force?
Yes, sir. Vata is a metabolic, it has a role in metabolic activity. Like Samana Vata, we can take, sir. Samana Vata is near Samano Agni Samipasya. So it helps in the process of, it helps in the Agni initiation. It initiates the Agni and helps for the metabolism.
Hmm. Can you explain that Vata is a synergistic force? Because whatever the comparison you are made, almost it is nearer to the CNS and endocrine system only.
Yes, sir. Enteric nervous system we can take, sir.
Yeah. How can you say that it is a synergistic force?
So, enteric nervous system is it is helpful for mainly like it controls a digestion like
That is a
process.
basal metabolizer. It is. I am asking, Vata is a synergistic force. Vata is acts as a synergistic force because it activates the functions of the other lame doshas like Kapha and Pitta. Pitta and Kapha are Pango. So Vata will activates the other two doshas function. So hence Vata can be considered as a synergistic force. So anyhow, good topic, good presentation, but some clinical touch has to be done for each function what they have explained, like Pravartaka Cheshtanam, Uchchavachanam, Samiranagne, Sarva Sharira Dhatu Vyuhakara, and Dosha Samshoshana, Kshepta Bahirmalanam. Several functions they have explained regarding the Vata. For each, you have, if at least you explain one disease, so it will be well and good. Anyhow, good topic. Thank you.
Thank you, sir.
Dr. Aisha ma'am.
Dr. Ashwini?
Yes, ma'am.
Yeah, this is Dr. Sharani. Good presentation on the fundamental aspect.
Thank you.
I think Vata Kalakaliya also mentions environmental functions of Vata. I could not see much of its correlation explained in this presentation.
Yes, sir. Yes, ma'am. I have only explained about physiological in human body. Only, ma'am. I have not taken environmental.
Actually, today the main problem suffered by humanity is climatic change and there's so much
Yes.
of drastic endemic disorders like COVID and all. I think you could
Yes,
have
ma'am.
correlated this with the viral outsurge or outbreak. I think that point
Yes, ma'am.
you
Next
did not
time.
propose me. Okay. Apart from that, I think I totally agree with Sir, where you could have given some clinical correlations for whatever fundamentals you have explained, because that comes to level 2 on the next level. I think that can be implemented.
Yes.
Otherwise, it's a good presentation.
Thank you.
Hello, Dr. Ashwini.
Yes, ma'am.
It was a good presentation.
Thank you, ma'am.
So, one thing I want to ask, Niyanta Praneta Cha Manasa. So, this quotation, whether it is having any importance for a present era?
Yes, ma'am. When we control the vata, the manas will be controlled, ma'am. Otherwise, nowadays, youths are very much like they are focusing on unwanted things more than the good one, ma'am. So
Not
when we
only
control
youths.
our, yes, ma'am,
Not
everyone.
only youths, even at child age also, whatever we are getting, like watching more, increasing the screen time and all, so they require more concentration and more focused, what we call focused so for that reason, yes, it is required. And whatever the anxiety problem, the depression problem
Yes,
we are getting, so they are searching the solution for that. Okay,
yes,
that is nothing but this quotation suits them very good. Niyanta praneta cha manasa. Whatever yoga, whatever asanas we are adopting, so we are doing for that purpose only, isn't it?
yes, ma'am.
So I congratulate you. It was a good presentation. Nice.
Thank you, ma'am.
Yeah, Dr. Ashwini,
Yes, ma'am.
it was a nice presentation.
Thank you, ma'am.
But one suggestion what I would like to give you is
Yes,
you have generalized vata.
yes,
So if you would have been more specific in the types of vata, its functioning and all. When you go
yes,
to mental aspect, whenever you go to the excretory aspect and all, if you would have been showed like which you, if you would have related the vata dosha,
type of vatas.
yeah, that would have been more scientific. Okay.
Yes, ma'am.
And one question is, what scientific message would you like to give with this presentation? So, what is an add-on knowledge of this presentation?
Ma'am, vata is all three doshas are important for us, ma'am, but vata plays a more superior one because pittam pangu, kafam pangu, pangav malabadatava, we say. Vata is the initiator, or a vata helps for the pitta and kapha also. And vata plays a more important role, and also we see the more vataja and anatmaja vikaras also, because vata is the main dosha which controls the body also, and which will when it gets vitiated, it will vitiate all the systems and all the function also, ma'am. It is having more bala, so one should control the vata by the pranayama, yoga and all. And it also affects the manas also, ma'am. So nowadays manasika doshas are more, and like diseases are more, so one should have the control over vata. So vata is very important compared to kapha and
Okay, that's why as you quoted the manasika doshas and all, So that's why Usha Sanu ma'am was telling you like environmental factors. If you would have added the environmental factors, then that would have been apt, and even some clinical correlation was needed in this presentation. Okay, otherwise everything was good. Thank you.
Thank you.
Okay, I thank Dr. Ashwini ma'am. There is a request for all the participants to maintain the proper timing as they are exceeding the allotted time. Okay, we'll move with our next participant, Dr. Kavya Vyas. I'm sorry. It's Dr. Kavita Vyas.
Yes, sir. Am I audible, sir?
Yes, ma'am, you
Hello.
are audible.
Okay, sir. Shall I start my presentation?
Yes, ma'am, your time starts now.
Okay. Good afternoon to all the dignitaries present over here. Myself, Vaidya Kavita Vyas, Research Officer, Ayurved, presently working in Mandi CCRS, Himachal Pradesh. And today I'm going to present my review study entitled A Review on Concept of Gulm in Ayurveda with special reference to inflammation and pain. Why Gulm? The rationale behind this study is, next please. Gulm is a disease entity which has a very complex clinical presentation, and the management principle for the Gulm is also distinct. The nomenclature of the disease itself narrates that Avriktavata plays a significant role in pathogenesis of the disease, which makes the diagnosis as well as treatment more complex. Again, comparison of the disease with several modern terms and diseases makes it difficult to understand. Hence, comprehensive understanding of the concept is inevitable for its better clinical management. Next, please. Objectives of the study. Objective 1, to thoroughly understand the concept of Gulm from existing literature. And second objective is to understand Gulm in a reference of inflammation and pain. Next, please. Methodology. Several classical texts of Ayurveda, especially Charaka Samhita along with Sanskrit commentary, was explored. Search engines were also explored with relevant keywords, and various textbooks like Nidan Chikitsa, Hastamalak, and published PowerPoint presentations were also included in the study. Next, please. Review of previous research works. Few research works have been carried out till date on Gulma, either focusing on its surgical aspect or comparing Gulma with several types of diseases, including cancer. But till date, no particular study has been carried out showing connection of inflammation and pain with Gulma. Next, please. Literary review. Gulm is a densely accumulated, almost rounded bubble-like mass of doshas, especially Vat dosha. It may be single or multiple. It may or may not freely move within the cavity of its growth. And only when it becomes much dense or Kritavastu Parigraha, its overlapping muscles and skin appear to be elevated, as if otherwise it may not be examined by inspection. Next, please. Samprapti Ghatak or factors of pathogenesis. The first and foremost cause in the pathogenesis of Gulma is Agni Mandya. For those dosha samvarchana, it is interesting to know that Gulma is nirashraya, means it does not involve any dhatu in the Samprapti. Only Ashtang Sangra and Ashtang Hriday have mentioned involvement of Rakta dhatu in Samprapti of doshaj Gulma. Again, sequence of Shul in pathogenesis of Gulma also varies according to different acharyas. Like as Sushruta has mentioned Shul as an upadrav or complication of the disease, Ashtang Hriday and Sangra have mentioned Shul as a prodromal symptom and Gulm as a complication, while in Charaka Samhita, both of them have been mentioned as an intermingled phenomenon. Next, please. So the Swarup of Gulma, which is mentioned by Acharya Charaka in Trishothiya Adhyay, is Vatik Ekdeshiya Shodh. It clearly shows that the basic pathological phenomena for Gulma is Shodh or inflammation, and the cardinal symptom of the disease is Shud. Next, please. The types and signs and symptoms of Gulma, which are mentioned in different sthanas of Samhitas, are also vary. Likewise, in Sutrasan, 3 Gulma, including 1 dosh as Pradhan dosh, they have been mentioned. While in Chikitsa Sthan of Charaka Samhita, 3 Dvandvaj Gulma have been mentioned, which are not there in the Nidan or Sutrasthan. Again, the Tridoshish type of Gulma is termed as Nichay Gulma, which is actually asadhya in nature, and Nichay represents its asadhyata. Madhav, Nidan and Chakrapani only have mentioned Raktaj Gulm in males, which actually involves Rakta Dhatu and not the uterine blood or Artha as Dushya. Next, please. Discussion. So, Gulma has specificity in its every aspect. Likewise, its generating cause, its Amshansha Kalpana, and the causes of the provocation of Vata dosha. Amshansha Kalpana is Vata is the foremost dosh in pathogenesis of Gulma, and mainly Apan and Saman Vat play a significant role in this with the Ruksha Guna and Vad alone or in collaboration with Pitta or Kapha. Here specifically Pachak Pitta and Kledak Kapha. It initiates the pathogenesis of Gulma with the gunas mentioned in the slide. Again, Nidan Vaishishti is there because in Nidan Sthana, Vat Prakop, which is responsible for Gulma, is mentioned due to Dhatukshay and Avran of Vata by another subtype of Vata. While in Chikitsa Sthan, the main cause of provocation of Vata is mentioned as Avran of Vata by Purish, Mutra, Kapha, Pitta or Ama. Next, please. Locations of Gulma, total 5 places have been mentioned as location. In this particular term, Parshva is important to understand, and the comprehensive knowledge of Ayurvedic anatomy makes it possible for us to actually understand the term Parshva. Next, please. In Samhitas, we can find that in Sushruta Samhita, while during the mentioning of process of mutra synthesis, the Vrukka has been considered as Pakvashay, or Sushruta has used Pakvashay term for Vrukka. So here the renal cortex may be considered as the Pakvashay, and renal cortex may be considered as Amashay, and renal medulla may be considered as Pakvashay because Pakvamutra is gathered here. Same way in prodromal symptoms of Chardi and in symptoms of Kafaj Gulma, Acharya Charak has used the word Hridaya in the sense of stomach, or it may be considered as fundus of stomach. So here when we say Parshva, it will be the Parshva of all the 3 sthanas, that is Hriday, Basti and Nabi. So actually it involves the whole thoraco-abdominal cavity. Next, please. Samanya Purvarup, though almost all of the Purvarup of Gulma indicate the dominance of Agnimanda in the disease. For clinical utility or for the diagnostic purpose.
Ma'am, the time is already 7 minutes 50 seconds.
Okay,
so please conclude.
Okay. Okay, so two prodromal symptoms are mean vomiting and Sahitya Asahatam, which may be attributed to Vyana Avrit Apan, that is stretch reflex. Next, please. Again, the sequence of pain in Gulma is responsible due to different consideration and sequence of the chapter in the Samhitas. Likewise, in Vagbhat Samhita, Gulma has been mentioned after Vidradi and Vriddhi involving Rakta Dhatu, and that is why Gulma is considered as a complication and Shul is a prodromal symptom. Next, please. Types of Gulma, again in Nidan Sthan, only Prakriti Samved types of Gulma have been mentioned, while in Chikitsa Sthan, considering the distinct management process, 3 Vikriti Visham Samved types of Gulma are added. Next, please. So conclusion, gulm is a self-contained shrub-like conglomeration of provoked dosh located superficially or deep inside thoraco-abdominal cavity, which may or may not be palpable. The basic pathogenesis of gulm is shoth and cardinal symptom is shul. Tissues or dhatus may get involved in later stage of pathogenesis. Extremely deranged status of Agni and exceeding emaciation are specific causes in generation of Gulma. It is generated by avran of Vata by another subtype of Vata or Purish Adi, and Vikriti Visham Samved type of Dvandvaj Gulma requires specific treatment in compared to Prakriti Samved type. Thank you.
Thank you, ma'am. The time taken by the participant is 9 minutes 30 seconds. And the session is open for discussion. I request the judges for any questions.
How can you approach such cases, madam?
Actually, sir, I selected this topic because when I was a teacher, it was proposed that I am from basic principal fraternity. So it was supposed that basic people should teach only Sutrasthana and Nidana and other sthana should be taught by Kai Chikitsa people or some other clinical people. So at that time, I thought that it's not actually fair because the Samhita is important to understand as a whole. Likewise, if we take this particular concept of Gulma, whenever we see our case papers or our data, we rarely find any disease termed as or diagnosed as Gulma. So that's why I thought that I should take the concept of Gulm from different sthanas or different samhitas and then mainly focus on the clinical interpretation of the disease. So I found this that for diagnosing or labeling any disease as Gulm, two things are mandatory. The first one is inflammatory process as a pathology, and second one is the shul as a cardinal symptom. The location, 5 locations have been mentioned, but actually the whole thoraco-abdominal cavity. So in whichever clinical cases we find inflammation and pain in the thoraco-abdominal cavity, that is only eligible to be diagnosed as Gulma.
I'm asking, what are the therapeutic principles that you will advise in the case of Gulma?
So therapeutical principles, according to the dosha, first of all the Agni Mante must be corrected and the Vata Prakopa should be, Vata should be pacified. Now the treatment principles further depend upon the location of the Gulma and the dhatus involved in the pathogenesis. If it is only doshaj Gulma, then the treatment modalities will be as per the different doshas. If it is Raktaj Gulma, it is Raktaj Gulma in female, then it may be up to some extent considered as uterine fibroids or some inflammatory condition. So that will be the entirely different disease to be treated. And if Raktaj Gulma is there in male, then again the treating principles will be different. So I think that for the treating principle, 3 things are main. First of all, Agni Mante correction, Vata pacification is there, and then treating according to the place and the tissues involved in the disease.
Oh, what are the integrative insight according to what you have said, the main role that is Agni Mande? What Agni Mande has to be considered in case of Gulma? Either it is only the low digestion?
No, sir. Likewise, in some cases, if we are considering Pittaj Gulma, then we can consider pan gastritis also, hyperacidity and other symptoms also as Agni Mande. But if it is Kafaj Gulma, then purely it is different thing. So Agni Mande will again, it will differ in as per the Anshancha Kalpana and as per the dominant dosh involved in the pathogenesis.
So Agnimande has to be considered completely as a gut physiology also, neuroenteric signaling also in the case of Gulma, and even though the cellular metabolism has to be understood.
Yes, definitely. Yes, sir.
So that impaired digestion, it will lead to the ama, vata aggravation, that will lead to the abnormal movement, and srotro avarodha means the localized pathology, what you are saying that
Yes,
shotha.
yes,
So gut dysmotility, chronic inflammation, and neurogastroenterological dysfunction and
yes,
abdominal mass pathology has to be corrected.
yes, sir. Whatever is involved in that particular type of gulma.
Hmm. So what are the things or what are the drugs you will select for Agni Deepana and Amapachana in Gulma?
Again, sir, I will say the same thing that if it is only due to provoked bath and involvement of pith and cough is very less, then definitely for Agni Deepan we can use this Ushna, Tikshna and Vata Shamak property herbs. But if it is due to Pittaj Gulma or Pittaj Shot is present there, then the Agni Deepan will be a little bit, I mean, tricky because we will have to use some Tikta Dravyas and Langan will also not be possible as much as in Kapha Gulma.
I am asking only the Agni Deepana is required or else Amapachana is also required. Along that you have to select a drug or you just name the drug so that it can enhance the Vatanulomana also along with the Deepana and Pachana too.
Okay,
So
sir.
that to
So I
restore
think
the gut
that
motility.
I
To
think,
restore
sir,
the gut motility.
likewise, if it is Vataj Gulma, we can use particularly Hingvastak Churna. Or
Hmm.
if it is Pittaj, then we should use Guruchi Sattva or Guruchi in some other format like Sanshamni Vati, or it may be some another Trifla can be used for particularly this one.
Hmm.
And for Ama, I think that Ama, though Agnimande is there, initially may or may not be involved in the pathogenesis. If it is purely Vatic type of Gulma, then it may be Niram also. Because here the Vata Prakop has been mentioned by two different modes. Likewise, one is Dhatukshay and second one is Avran. And in Avran also there are two types. One is again Vata Avran due to another type of Vata and Vata Avran due to Am Purish and other things. So it will depend upon the stage of the disease also.
Okay. Thank you. Good topic.
Okay. Thank you, sir.
Ma'am, your voice is not audible. Usha ma'am.
Yeah, good presentation. I think I don't have any comments on it.
Thank you, ma'am.
Aisha ma'am.
Hello. It was good presentation, ma'am.
Thank you, ma'am.
So I don't have any questions. I congratulate you. So only the time management should be taken care of. So
Okay.
otherwise it was good. Nice.
Santrupti ma'am?
Yeah, that was a good presentation. No any queries.
Okay, thank you ma'am.
Thank you, sir.
Now I call our next participant, Dr. Suchitra S. Patil.
Sir, slides.
Are you ready ma'am?
Yes, sir. स्थापकाय च धर्मस्य सर्वधर्मस्वरूपिणे अवतारवरिष्ठाय श्रीरामकृष्णाय ते नमः. Namaste all, and I thank organizers for giving me this opportunity. My topic is effect of Shorita Shilajatu and Rasa Basma on anxiety. It's an animal study, vital study. Actually, now I am working in SOS as associate professor, but it was a study when I conducted during my MD. It was guided by Dr. V.B. Joshi sir and Dr. Pradeep Agnihotri sir. Next slide, please. So, the background that these two are Shilajatu and Isabasma are mineral compounds, where Shilajatu has shown its effect on diabetes, obesity, and anxiety, and Isabasma has shown its effects on higher cognitive functions. With this background, the main objective of the study was to observe the effect of Shodita purified Shilajatu and Isabasma on anxiety of a mice model. Next slide. So, it was conducted in Ayurveda Mahavidyalaya, medications are prepared there, and animal study was conducted in Sonia College of Pharmacy. Next. And the preparation, like purification of Shilajatu, was carried out by Surathapi method, and purification of Shodhana of Rajata was Samanya Shodhana was using with the Taila, Chakra, etc. as per the classical explanation, and Vishesha Shodhana was carried out by Jyotishmati Taila. Bhasma was prepared using the Kumariswarasa Bhavana and as per Ayurveda Prakasha guideline. And analytical study was done to check the ash value and organoleptic characters, etc. Next. So this study was conducted in Sonia College of Pharmacy. There were 4 groups of animals. One group was given standard treatment, one group was given saline, one group was given the Shuddha Shilajatu, another group was given Rasabasma. Next. Next slide, sir. And there were 3 tests or animal models which were used. One is light and dark chamber test and locomotor activity test using octophotometer and rearing behavior using open field exploration test. This was a method to check whether medicine has worked or not. Next. So, analytical study results where it is showed that these two, Raisabasma and Shuddha Shilajatu, was prepared accordingly based on this result. Next. Next, sir. And here we can see the result of entry in light and dark chambers, which shows that entry of light chamber was increased in Shilajatu and Raisabasma. Even dark chamber, which shows that there is a reduced anxiety. Next. Even locomotor activity, which is increased in a Shilajatu and Raisabasma group when compared to the normal saline group. Next. Number of rearings were also increased in a Shuddha Shilajatu and Raisabasma group. Next. So basically this anxiety would have been reduced because of reducing the GABA, increasing the GABA activity in animal model. That is a proposed mechanism. So conclusion is significant effect we have seen of Shuddha Shilajatu and Rasa Bhasma that they have reduced the anxiety through the light cells, locomotor activity, and rearing when compared to the placebo and the standard drug. And in that also, Rasa Bhasma was more better than Shilajatu group. Next slide. These are some references. Thank you for patience listening.
The time taken is 4 minutes 35 seconds, and the session is open for discussion. I request Dr. Abhishek sir.
Please go to the next slide, please. Next. 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 Yes. Come to that slide only. Light and dark chamber test. Namaste, ma'am.
Yes, sir. Namaste.
Your topic is very good, very nicely we have presented, and time is taken is very less. Can you elaborate this light and dark modes?
Sir, yes, there was a model which was used where there will be a one chamber. Animals will be made after the once they will be given the dosage, and animals will be frightened to enter the dark chamber, and even the movement will be in a light chamber will be less if they are anxious. So here the movement was more. It means they are not having that much anxiety after the medication.
So, light is good or dark chamber is good, ma'am?
Actually, light chamber is good, sir. Even dark chamber is also considered as, it means locomotion is good in either of the way. Actually, they will check for a light chamber only, as far as I know.
So, either it is the effect of your Shuddha Chilajatu and Rajata Bhasma,
Yes,
or
sir.
else the light and dark chamber effect is also there.
Sir, actually, we are comparing with the placebo and standard drug. So, if it is more movement, it's possibly because of medications only.
So, light and dark chamber, then what is the idea behind to select this light and dark chamber?
Yes, sir. Light means as it's a mice study, it is not like a human being. We are testing through this whether these animals are able to cope up with this light and dark adjustment, etc.
So, what I am asking,
Yes,
what
sir.
is the idea behind to ask this question is,
Yes, sir.
there is a lot of changes in the light and dark chamber what you have selected, not only in the animals, even though in the human too.
Yes, sir.
So that's why I am asking that either the effect is only of the medicines what you have given, or else the light and dark chamber also, because several neurophysiological changes will happen in the dark mode, several
That is
neurophysiological
there, sir.
changes will happen in the light mode.
Yes, sir. That is there. Correct. Yes.
So will you please conclude that the only the medicine has worked, or else the effect of the light chamber also and dark chamber also?
Sir, as I mentioned, we are comparing with even standard drug and saline thing. So, possibly medicine has worked. That can only I say, because as you rightly said, we are not analyzed the neurochemicals or something to exactly say the mechanistic of action.
The stress and anxiety,
Yes,
it
sir.
will be more in the light mode.
Yes, sir. That
In
is
the
there.
dark mode, it is less
Yes.
because
Yes.
the inflammatory status
Markers.
they will reduced in the dark mode.
Yes, yes.
So hence we will advise whatever may be the sort of the disease to the patients to take the rest. Yes, so
sir.
several effects that will be seen, or several in the articles also I have referred that
Yes,
taking
sir.
a nap for 5 minutes in the morning time,
Yeah.
it will leads to the premature death also.
Yes, sir.
So hence night sleep is very good because environment is also dark,
Yes, sir.
and closing the eyes and all those things will affect the neurophysiology.
Correct, sir. Yes, sir.
So you have to evaluate not only in concern with the medicines what you have advised to the
Yes, sir.
for your study,
Yes,
rather
sir.
than you can check it out that the light mode effect and the dark mode effect also.
Sure, sir. Yes, sir.
Thank you. Thank you.
Thank you, sir. Thank you so much.
Hmm.
Dr. Santrupti ma'am.
Yes. Yeah, Dr. Suchitra. That
Yes,
was
sir.
really a
Yes,
nice
ma'am.
topic
Namaste.
and nice presentation also.
Yes, ma'am.
Actually, I would like to know what was the dosage of Rajata Bhasma and Shilajitu?
1 minute, ma'am. Actually, it's long done. I have forgotten. I will check. And 1 second. Actually, it is 8 mg or something.
Okay, and what about Shilajitu?
1 second, ma'am. Twelve point 5 mg for of Rajata Basma, and Shilajatu was 22.5 mg per body weight. Ma'am.
Okay, can you throw a light on the usage of, like you have mentioned, Dicipam and even the Shilajitu Rajata Bhasma, that too
What,
in
ma'am?
dark chamber and light chamber, right?
Hi, yes,
Can you
ma'am.
just brief this, like actually what was the result?
Yes, ma'am. In light chamber, the entry was more in Shilajatu and Rajata Basma group, while in dark chamber also.
No. I'm asking you about the Dicipam and the Shilajitu.
Okay, ma'am. So diazepam, again there is a increase from compared. Sorry, Shilajatu has increased from the diazepam. Even the dark chamber entry is also more from the diazepam.
Okay. So what conclusion would you like to give?
Yes, ma'am. So where it shows that there is a reduced anxiety when compared to the diazepam.
Okay. Can you throw a brief light on, would you like to correlate dosha involved in anxiety and the medicine which you have used?
Yes, ma'am. Actually,
In brief.
as far as I analyze, it's a vata pitta which are involved in anxiety, basically, according to my analyze. And Shilajatu and Rasabhasma actually work to reduce the vata and pitta. So that's how, according to dosha wise, it may have showed improvement.
Okay. Thank you, Suchitra.
Thank you, ma'am.
Dr. Aisha ma'am.
Okay.
Yes, ma'am.
So yes, during this study, I was very glad.
Ma'am, actually, voice is breaking. Hello.
Is it audible?
Hi, yes, ma'am.
You are
Now
clearly
it is-
audible to me. Now
Hi,
is
yes,
it
ma'am.
audible?
Yes, ma'am.
Yes. So have you went through the symptoms of anxiety? After giving these medicines,
Hi,
the
yes, ma'am.
symptoms of anxiety, whatever we get now, like the palpitation or the cooling of hands and palms, these are the symptoms what a person will tell us, okay?
Yes,
A
ma'am.
patient, okay, or increased, sometimes increased blood pressure and all. So have you clinically observed the decrease of symptoms or anything else like that?
through any medication. No, ma'am. Anxiety actually I have tried ashwagandha.
Not through any medications, through your medication itself, like Shilajatu, after giving the Shilajatu and Rajata Basma. Which one is?
No. Clinically on human beings, no. Not still I have tried, ma'am.
Okay.
Yes, ma'am.
Okay. Nice.
Yes, ma'am. Thank you.
Dr. Usha, ma'am.
Yeah. Good presentation, ma'am.
Thank you.
Ma'am, I would just like to know, how did you induce anxiety in these animals, in rats?
Yes, ma'am.
How was anxiety induced in these rats?
Ma'am. It was induced through the.
Because in human beings, we get anxiety patients. But why should rats be anxiety?
Yes, ma'am. So it was induced through the medicine, ma'am, actually.
What medicine was used, ma'am?
Okay, yes, ma'am. Hello?
Yeah, I'm listening.
Yes, ma'am. This was a light and dark mode where they have induced anxiety through the making them to enter in a light and dark chamber. The main thing is that.
So you have studied their anxiety by seeing their entry in light and dark chamber.
Yes, ma'am.
And after medications, for how many days was the medications given, ma'am?
Actually, it was given for 15 days or 1 month, ma'am.
Okay. And what the difference was seen entering into the light, dark chamber.
Yes, ma'am.
Your chart, your table shows that the stay period in the dark chamber was increased after Shilajatu and Rajata. That is what your table is showing.
Yes, ma'am. Yes, ma'am.
Okay, ma'am. Thank you.
Yes, ma'am. Thank you.
Thank you, ma'am.
Yes, sir. Thank you.
We have our next participant, Dr. Yogita Trivedi. Are you ready, ma'am?
Yes.
Okay, you can start, ma'am.
Good afternoon, respected teachers and everyone present here. I'm Dr. Yogita Trivedi, a PG scholar from All India Institute of Ayurveda. Today, I'm presenting a case report on effect of Virachan Karma in a metabolic triad. Next. Introduction. Metabolic triads are increasingly rising among young adults. Dyslipidemia, prediabetes state, and impaired thyroid function can often coexist. Conventional management focuses on individual biochemical correction with limited emphasis on root cause. From Ayurvedic perspective, this condition can be understood as Kav Pradhan Tridosh Santarpajanya Vyadhi, where Agniman leads to arm formation and Shotadushi, primarily affecting Rasva and Medava Shotas. In such conditions, Shodhan Chikitsa, especially Virachan Karma, offers a systematic approach by targeting the root pathology. Next. A 27-year-old female patient presented with the complaints of weight gain, acne, hair fall, reduced exercise tolerance, heaviness, and fatigue. Next. She had a sedentary lifestyle, frequent intake of oily and processed food, irregular sleep, and occasional constipation. On examination, Agni was month, Jivva was Sam, VM Shakti was Avar, BMI was 25.5 kgs, which was slightly overweight. These findings indicated Rasvaha and Medva Shotadushti with cough dominance. Next. Investigations showed elevated cholesterol and LDL. Raised TSH indicates subclinical hypothyroidism. elevated fasting blood sugar and HbA1c, increased erythrocyte sedimentation rate. Next. Here the Nidan were Guru Snigdh processed junk food items and Vihar, Divaswapna and Avyayam. So the diagnosis can be made as Kaf Pradhan Santarpajanya Vyadhi with Medhuva Dushti, and in modern we can correlate it with dyslipidemia with subclinical hypothyroidism and prediabetes. Next. The pathology can be summarized as Nidan Sevan leads to Agni Mandya, where Pitt and Kaf Dushti occurred, and which leads to arm formation and Shotorod, which further leads to Medo Dhatu Dushti and manifestation of metabolic disorders. Next. So the treatment protocol was classical Virechan Karm, which was occurred in 3 stages. Firstly, in Purv Karm, Deepan Pachan was with Panchkul Churn was given BD for 3 days, and followed by Snepan with Murchit Krit, and then external Snehan and Swedan was done for 2 days. Then Pradhan Karm, in Pradhan Karm, Virechan was done using Trivrat Avle and Triflaquat, and proper monitoring of Vegas were done. Then in Paschat Karm, Sansarjan Kram was followed for 5 days with strict Pathya for the restoration of Agni. Next. Patient was advised to follow the Pathya. She was advised to take warm water, light home cooked food, early sleep and early waking, avoid of junk food, sugar, processed items, day sleep, and sedentary habits. Next. The patient achieved Samyak Virechan Lakshans with Pravar Shuddhi, 28 to 29 weeks. Kafan Shuddhi was observed. During Snepan, her weight reduced 3.5 kgs, and post Virechan 1.5 kgs. So total weight reduction was 5 kgs. There was marked improvement in all the parameters like lipid profile, glycemic parameters, TSH levels, and erythrocyte sedimentation rate. Also, there were significant relief in symptoms like fatigue, acne, heaviness, and also there was reduction in central obesity. Next. These were the before and after parameters. Next. So this case can be understood in Ayurveda as Kaf Pradhan Tridosh Santarpajanya Vyadhi, where excessive intake of Guru Snigdh processed ahar along with Avyayam and Divaswapna leads to Agni Mandya. This impaired Agni results in the formation of arm, which further causes Shotarod, especially in Rasvaha and Medhava Shotas. Due to this, there is Medho Dhatu Vriddhi, Kled Dushti, and Dhatva-Agni Mandya, which clinically manifest as dyslipidemia, prediabetes, and subclinical hypothyroidism. Rational Virechan Karm ka hai. The Virechan was selected because it is the prime shodhan for Pitta and also effectively eliminates cough and associated with Pitta. Also, we read in Jwar Chikitsa that Pittam va Kaf Pittam va Pittashay Gatam Harit. So there was involvement of Pitta Ashes. So Virechan was preferred in this case. And it acts as Shodhan Rupi Langhan, which helps in eliminating accumulated dosh, clearing obstructed channels, correcting Agni at both Jatragni and Dhatvagni level. So probable mode of action of Virechan, Agni Deepan and Amnirharan, which helps in restoring proper metabolism and clearing toxic metabolites. Kaf Pitta Shodhan, Shoto Shodhan, especially in Medhuva and Shoto Rasava Shotas, Medhu Dhatu Agni Deepan, and Klesha Shoshan, reduction in lipid levels and better glycemic control. Dhatvagni correction helps restore endocrine balance, reflected here by reduction in the TSH level. Next. So, the drugs used were Trivrat Avle and Triflaquat. Trifla Avle possessed the Rechan Ushna Tikshna Gun, which helps in effective dosh accumulation, arm clearance, and lekhan activity. And Triflaquat acts as Deepan Pachan, which supports bowel regulation through anuloman
Ma'am, you
and
are exceeding your time, ma'am. It's already 7 minutes.
okay. The role of Patya Patti here was to avoid the arm formation and Agni Deepan. Thank you.
Requesting the judges to have any questions. Dr. Usha, ma'am.
Madam, can you just brief on the discussion?
Ma'am, this case can be understood as Tridosh Vyadhi with Kaph and Pitta Dushti. So we here thought to go for the Virechan, as Virechan is good for Pitta Dushti with Sanskrit Vat and Kaphadosh. And for that we gave the Trivrat Avle and the Shmul Kwad. And the Shaman Aushad was not given because already there was significant reduction in all the parameters. So the patient was advised to follow the Pathya for maintaining the uh,
But was the follow-up done?
yes,
After how many days follow-up was done?
1 month follow-up was done.
What was done in follow-up?
Uh, she was just advised to follow the matlab Pathya, and then we assess all the parameters again after 1 month, and they all were maintained after 1 month. Still, follow-up is going on, but after 1 month we have checked.
All Lakshana, whatever were there, do you think within 1 month it got suppressed?
Yes, she really felt high energy levels, and abhi, matlab, after 1 month, because her sleep cycle was also corrected, and because of the diet, uh, is she felt uh, uh, reduction in all the symptoms like acne, hair fall, and energy levels. Also,
How
she
about
felt.
PSH? You had mentioned about PSH.
Yeah, that was 5 point something before the treatment, and it was reduced to 2 point something, 2.6 after the Virechan.
Thank you, ma'am. Good presentation.
Soon after the
Dr. Abhishek, sir.
Virechan, you got this result.
Yes,
This Yogita.
this is after the Sansarjan completion of the Sansarjan Kram.
संसर्जन क्रम होने के बाद ये 2.0
Yes, ma'am.
Before it was 5.76.
Your voice is breaking, ma'am.
Is it audible?
What?
Now क्या सुना?
Ma'am, you are not
आपको?
audible.
Hello.
Yes, ma'am.
Audible है?
Yes.
हाँ. तो क्लासिक विरेचन था ना?
Yes.
तो स्नेहपान कितने दिन का कर
5 days, ma'am. 5 days.
कितने ml गया था?
Ma'am, starting was 30 ml and last day, 5th day, 250 ml.
250 ml.
Yes, ma'am.
Hello.
Yes, ma'am.
घृता जो आपका था ना,
Yes, ma'am.
त्रिवृत हा घृत कोणतं?
मूर्छित घृत.
मूर्छित घृत.
Yes,
मूर्छित
ma'am.
घृत. ओके,
Yes, ma'am.
नाईस. Nice result. Okay, thank you. Thank you.
Thank you, ma'am.
Yogita, it was a nice presentation. I
Thank
would
you,
like to
ma'am.
know what was the age criteria.
Ma'am, she was 27-year-old. There is only one case.
Okay, it's a single case. Okay.
Yes, ma'am.
Okay. Nice presentation, Yogita.
Thank you, ma'am.
What is the idea behind to select that Panchakola Churna?
Sir, for Deepan Pachan.
No. In this case, why you have selected Panchakola Churna as only for the Deepan and Pachan? Other medicines are also there.
Sir, there was no like specific reason for choosing Panchkol Churna.
The something specification is required because you have got the results.
Sir, actually, cough was slightly increased. That's why Panchkol Churna was chosen.
How it will have acts on kapha? Panchakola Churna. And you are saying that kapha pradhana, kapha pradhana, kapha pradhana. Right. Already subclinical conditions like hypothyroidism is also there. Right. So near to the ura, it is also in kapha. Why not you have selected the Vamana?
Sir, because there was also the involvement of पित्त and पित्ताशय व्याधि हम मतलब मान सकते हैं थायराइड को. That's why.
Pitta thyroid. How can?
Yes.
Can you justify?
What?
Can you justify that hypothyroidism it is a pitta vyadi?
Sir, because there was Agni Mandya and because of that the disease there was metabolic disorders. So I think because of that we can say it is a Pittashay Vyadhi.
Why Murchita Krita? Snehapana. Idea behind to select. As a patient condition, what you have explained, according to that, you can suspect the snehana, which is easily digestible, like Sukumara Krita, and the patient is female, age is also very less. You can select the Dadimadi Krita also. Why you have selected Murchita Krita? See,
Sir,
for selection of medicine, there must be something a criteria. So you have chosen the medicine, you got the result means. So you have to justify on which basis the result has come. Only through the Virechana or only through the Snehapana or else
sir,
whole.
I think whole Virachan
Not
due to whole
Deepan Pachan,
Virachan.
not Deepan Pachan,
No,
not Snehan Sweda.
Deepan Pachan obviously total Virachan के वजह से ही we got the result.
Will you elaborate that slide, the condition of the patient when they have came to you? Please
Sir,
show that slide.
she was suffering from frequent acne. Her energy was very reduced, letharginess, tiredness, and hair fall, reduced exercise tolerance. These were the conditions.
So for this, anatomically, how you can correlate as she is having tiredness, laziness, acne, right? All those things she is having. And you are saying that it is a Pitta Shegata Vyadi. Of course, it is a Pitta Shegata Vyadi according to the symptoms what you are explaining. But you justify it. I will justify it, but you justify.
Sir, according to her dietary habits, she is having sedentary lifestyle. So
Yeah.
there was Agni Mandya at both Jatragni and Dhatvagni level. That's why.
No. When you are saying it is a Pittashegata Vyadi, the concept of Adoga Dhamani comes. You just once cross check the Dhamani Sharira, which is explained by Acharya
Sure.
Sushmita, right?
Yes.
So, Vipakvam Aushnyad Vivechayantasya. The concept he has explained very beautifully. Vipakvam Aushnyad Vivechayantasya. So, depending upon that, it will make the Sharira Tarpana and Sharira Arpana. So that is the problem, and that is the thing, and that is the justification why it is a Pitta Shegata Vyadi. And due to that, why she is feeling the tiredness, why she is feeling the laziness. And as it is a Pitta Shegata Vyadi, you chosen the Virechana, so it is corrected. The case, you got the result. But
Yes.
still the question remains with you. Why you selected the Panchakola Churna Murchita Krita? Why not the other medicines? Let it be very good presentation. Time taken by the presenter, please mention.
Sir, it's 7 minutes 15 seconds.
7 minutes 15 seconds. Okay. Thank you.
Thank you, sir.
Okay, thank you, ma'am. As we are running shortage of time, I request the other participants to not exceed the stipulated time. From here onwards, we will lock the time to 5 minutes, and the judges please can raise once the time is up. Our next participant is Dr. Dilepa. Sorry, it's Dr. Dilopa. Yes, ma'am, you can start. Dr. Dilopa, ma'am.
Go to the next presenter. I think they are not here.
Dr. Dilopa, ma'am. Yes, sir. Ma'am, please you unmute yourself.
Hello, sir.
Yes, ma'am, you can start.
Okay, sir. Good afternoon, everyone. I am Dr. N.V.Y. Dilupa. With the guidance of Dr. Divya P., Professor and the HOD, Department of Roganidana, Sri Dharmasthala Manjunatheshwara College of Ayurveda and Hospital, Hassan, on the topic, Role of Ayurveda in the Treatment of Guillain-Barré Syndrome or GBS, a review of case reports. Next, please. Along with these contents, next slide, please. As introduction, GBS is a rare but serious autoimmune neurological disorder causes rapidly increasing muscular weakness. Areflexia often happens after an infection. It can even a life-threatening condition. Thus, IVIG and plasmapheresis are required emergency treatments. But following that, many patients still need long recovery period and some do not recover fully, making us to think, can Ayurveda help in such cases? The objectives of this review were to identify the available evidences regarding the clinical outcomes of Ayurvedic treatment in GBS and to understand GBS from an Ayurvedic point of view. Next slide, please. The search on open access published case-based clinical evidences in last 10 years. These databases was on these Boolean operators used to finalize full text articles. Next slide, please. The clinical presentation, diagnostic criterion, diagnosis based on Ayurveda in particular case studies, outcomes, next slide please, and outcome measurements are summarized within these tables. Next slide please. Next please, sir. I'll move on parallel discussion based on these results due to time being. The findings shows the fairly consistent improvement across the reviewed case reports. Most importantly, muscle power improved in all studies. Functional recovery from bedridden to walking independently within 45 to 165 days and improved sensory symptoms and restored reflexes within 2 to 3 weeks are notable neurological improvements. And some patients who had poor responses to IVIG and plasmapheresis also showed improvements, suggesting supportive and rehabilitative role of Ayurveda to the context. Next slide, please, sir. The outcome measures not only based on observations, but also by several objective outcome measures. They utilized Barthel Index, Modified Rankin Scale, NIH Stroke Scale, and Hugg's GBS Disability Scale, and EMG and nerve conduction velocity findings, which give scientific support to the clinical recovery. Next slide, please. Most of the cases appears that Basti is the main therapy in the Ayurvedic management of GBS. GBS was mainly be understood as Sarvangavata, Vatavyadi, Kaphavrita Vyanavata, and Amavata in different cases. Here, Vata may be explained the motor weakness and paralysis. Kapha may be related to the obstruction or avarana or heaviness conditions, and Pitta may be represent the undergone inflammatory component. In commonly used treatment patterns, Basti helps the control in Vata. Svedana may be improved circulation and neuromuscular function, and Rasayana may help in recovery and regeneration. The stage-wise treatment also important where the Ama stage, Langana and Pachana, and in the Nirama stage, Basti, Snehana and restorative therapies. And in Avarana conditions, we have to consider about the Avarika Vimo to go through the more suitable therapeutic approach. An important limitation and the biggest challenge is to know whether these improvements happen because of the actual treatment effect of Ayurveda or because of natural recovery process of GBS over time. In most of these cases, showed improvements followed by the treatments which used to be aligned with prevent worsening. However, in this manner, even though the results are promising, they should be still be interpreted with the scientific caution with comparative improvements. Next slide, please, sir. To conclude, this review suggests that Ayurveda shows consistent positive outcomes to the management of GBS in clinical presentation and in evaluation methods. Among all the therapies, Basti appears to be central and stage-wise treatment planning seems to be very important for better results. As diagnosis is not limited to the fixed in Ayurveda approach. It should be approached with Trivida Bodhya. Based on the available evidences, Ayurveda may be useful as a complementary therapy, a rehabilitation strategy, and also a supportive option in non-responsive cases. However, since the present evidences are still mainly limited to the case reports, there is a strong need of well-designed clinical trials and standardized treatment protocols. Thank you for giving me the opportunity for the organizing committee.
Thank you, ma'am. The time taken is 5 minutes 13 seconds, and the session is open for discussion. Judges, if you have any questions, you can raise.
How can you assess the GBS in pediatrics?
Sir, in pediatric, I have excluded in this my case follow-up. In pediatric cases also, the treatment are based on same protocol, but their dosage and their approach depending on their age, because some treatments cannot be directly approached like Vamana Karma or some because of their age limit we can't given. So though I am excluding this in my article selection, there were some studies based on pediatric approach, but in that we have to consider about their age and dosage and their tolerability and their thorough evaluation needed, sir.
How can you assess the power of muscle in the pediatric?
In the pediatric, sir, the usual muscle power grading is 0 to 5. In that, if it is a lower motor neuron lesion, in that if power grading can be decreases over the resistance, especially if it is less than to grade 3, we have to take the action. But specifically, I don't know whether there anything regarding the pediatric patients. For adults, we are following that.
For the age of 1 to 10?
Don't know, sir.
GBS for the age of 1 to 10.
No.
There are several tests are there to assess the muscle power.
Sir.
So how can you will assess? That may be taken as Samvardana Gada.
Maybe, sir.
Can you elaborate that Samvardana Gada with the GBS?
The developmental delays can be happened with the response to the their natural growth.
So how can you will assess the muscle power in such?
If they can't perform the activities
like as a physician, how you can assess?
Like I'm not exactly telling, sir, because I don't have that much proper idea regarding pediatrics, but like in Govern's we are taking in muscular dystrophies like that, if they can't perform these activities, different position changes can be considered, sir.
There are several tests like ballooning, filling the air in the balloon to assess the muscle power of your total oral cavity, putting the thread in the needle for the fine movement, raising the hand, standing for 5 minutes, walking for 10 steps, walking for 10 steps only on one leg. Ballooning is there, buttoning is there. So few of the patients which I have seen in the child group of 6 to 7 age, they are able to make the buttoning only 2 buttons. They are not able to make the third button. So these are the muscle power that has to be tested, especially what you have considered about the muscle power in this GBS syndrome. Right? Okay. So how can you assess in the adults? Either can we consider it as a muscular dystrophy?
No, sir. While describing as muscular dystrophy, there we have other diagnostic criterion like CKMB levels and all can be altered. But in there in GPS, what's happened in that neuromuscular discoordination happened because mostly myelin sheath damage and all prevent the proper conduction over the proper nerve conduction. But in muscular dystrophies, what's happening that the muscle mass starts to initiate the disease process. In that, with the time, that interpretations also will be differ because CKMB we can't consider with that as reduce the muscle power, enzymatic output also can be differ. So the diagnosis is based on totally different perspectives.
So you please explain the total treatment protocol
for GBS, sir.
Yeah.
According to the review articles and their perspectives, sir, what I understood in GBS, we have to consider especially that there are, when we consider about modern perspectives, it may be in acute or plateau stage and it can be going through.
No, you explain only Ayurveda. Only explain Ayurveda.
In the initial stages, because of that autoimmune conditions, it will it can be considered as that manifestation of armor conditions where antibodies can be attacked over the human body, nerve endings. In that, the neurotoxins can be accumulations, and those will be further damage over the myelin sheath and all, where armor we can consider. With that, if it that.
Which dhatu has to be considered more?
Sorry, sir.
Which dhatu has to be concentrate on more in GBS?
Which?
Dhatu. Which dhatu has to give an importance in the GBS?
Dhatu, sir.
Which one?
Medo dhatu, sir.
No. As Hridaya is the sthana for the rasa, rasascha abhipurayanti. So when Hridaya feels good, then rasa will enhance. When rasa will enhance, further dhatus will form. Why you are saying that Meda dhatu? Priyar dhatu doesn't have any importance.
Sorry,
Why they have kept rasa as a first?
Yes. So in nourishment, Uttarottara dhatu portion, we can consider that rasa dhatu is most important. And in other hand, dhatu agni levels also affecting, sir, in that case.
Then why you considered Meda?
Majorly Meda, that Meda Shisna is Sambhavan, sir, that
Rasascha vipurayanti. If first dhatu, if it is not formed, if your heart feels not good to any food, no further dhatus will form.
Yes.
Thank you. Anyhow, good presentation. But according to the GBS, what you have selected, at least one case you have to present here. Okay, thank you.
Thank you, sir.
Good presentation, madam. Madam, can you tell me how about in the review, what did you find gender-wise, what is the prevalence of GBS?
Sorry, ma'am. It's not audible clear, ma'am. Can you please repeat?
Yeah, the question is, what is the prevalence of GBS as per the gender?
I was not going through separately, ma'am. But it's very rarely as faced by some infectious, that autoimmune condition. In world population, 5 to 10% has telling, but gender-wise, I didn't go through, ma'am.
Okay. And what about the dosha and dushya? How do you put the samprapti ghatakas?
When considering about dosha, the majorly vata dosha is affecting, especially at the end stage. And initially, we have to consider about all three doshas because kapha is affecting due to that heaviness and that all features will be manifest. Then pitta, because of undergone inflammatory conditions, though it is not presented to the clinical presentation directly, undergone pathophysiology may be denoted for pitta involvement, and basically for vata dosha, and in that also vyana vata we have to consider more, ma'am.
Okay.
Dr. Dilupa.
Yes, ma'am.
Yeah, it was a nice presentation.
Thank you, ma'am.
I would like to know, among it was 43 were screened, right? 43 cases.
No, ma'am.
43.
43 screened, but I have selected 14 because of some duplications and lack of factors. I have rejected others, 32, and I finalized with 14 articles.
Okay. What type of basti was used among all these?
Ma'am, it's depending on the Anuvasana basti and Niruha basti both those were applied, especially in Tarpana stages. In most of the cases, they used to utilize Thaila basti, and in early stages, they used to use Kashaya basti, ma'am, especially with this Dashamula Kashaya and Erandamula Kashaya have been noted over the selected cases.
Majorly Shodhana basti, then after that Brahmanartha, what?
Brahmanartha, Thaila basti.
Yapana basti, what type of bastis they had used? I'm not asking you this yoga pattern. I'm not asking you.
Pattern, ma'am.
I'm not asking you the pattern. I'm asking which type of bastis were selected.
Initially, mostly
what?
Shodhanartha, ma'am. Initially, Shodhanartha means after
Then
Deepanapasana, after that, Bruhanartha.
Okay. And would you like to quote few rasayanas in this GP?
Uh,
Or have you have you seen any rasayanas which they had
yes, yes, ma'am.
suggested
They
after,
have
as it
in
is an
some studies.
autoimmune disorder?
That Sutta Shekara Rasayana and Ashwagandha Rasayana have specially mentioned in some cases over the GBS here, ma'am.
What was the most common age which was affected in all these cases? What was the common age?
All cases in between middle age, ma'am, in between 30s to 50s, majority, but in 20 ages and 60s patients also were there in considered case studies, ma'am.
Okay, thank you, Dilupa.
Thank you, ma'am.
Is there any questions, ma'am? Am I audible? Okay. Thank you, Dr. Dilupa, ma'am.
Thank you, ma'am.
Now we'll
Sir.
move with our next participant, Dr. Aishwarya Hungun.
Yes, sir.
Are you ready, ma'am?
Yes, sir.
Okay, ma'am. Your time starts now.
Okay, sir. Good afternoon, everyone. Myself, Dr. Aishwarya Hungun. Today's my topic is Applied Physiology of Trimarmine Dasha Pranayatana, an integrative analysis of Ayurvedic and modern perspective. Next slide. Introduction. Ayurveda describes vital life, supporting structures as pranayatana. Marma are specific anatomical sites where multiple tissues like mamsa, sira, snayu, asti, sandhi converge. These points are crucial for maintenance of prana. Among 107 marma, trimarma, that is hridaya, shira, basti are most vital. Understanding their function helps in integrating Ayurveda with modern physiology. Dasha Pranayatana refers to the 10 vital seats of life described in Ayurveda. You can get reference from the Charaka Sutra 29th chapter. These structures are responsible for maintenance and sustenance of prana. They play a key role in preserving life and physiological balance. The term pranayatana is not a literal word-based definition but a functional term. These ayatanas are called so because injury to them leads to injury to life, destruction of them leads to death. Prana is not limited to specific organs like the bladder, etc. Instead, prana represents life as the union of body, senses, mind, and soul. Therefore, its seat are not just isolated organs but related to the respective system. That is, if you consider Hridaya, it comprises of the entire cardiovascular system and so on. Concept of Marma. Marma are vital anatomical sites described in Ayurveda, defined as the junction of Mamsa, Sira, Snayu, Asti, and Sandhi. There are total 107 marmas as explained in Sushruta Samhita. Next. Now let's discuss about Trimarma. They are Hridaya, Shira, Basti. These are classified as Sadhyo Pranahara Marma. These functional importance are they regulate circulation, control, and excretion, maintain prana and physiological balance, act as major life supporting centers. Hridaya, this comprises of entire cardiovascular system. Hridaya is considered as one of the most vital organs in Ayurveda. It is included in Dasha Pranayatana and it is classified as Sadhyo Pranahara Marma and it is one among the Sira Marma. Functions of Hridaya, as it is a state of Chetana, it is responsible for consciousness. As it is a site of Ojas, it is a vital essence, responsible for circulation of Rasa and Rasa. It maintains prana and life activities. Hridaya is considered as a root of Rasavasrotas, that is channels carrying nutrition, and Pranavahasrotas, channels carrying life elements in the form of air and oxygen. You can get this quotation in Sushruta Sharira, 6th chapter, that Hridaya Samarma Tanayoho Madhyam Adhishtaya Urasya Amashayadvaram Sa Tu Tattva Raja Tamasah Adhishtanam Hridayam Tatra Api Sadya Eva Maranam. That applied physiology of Shiras. Shiras is a vital organ included in Dasha Pranayatana. It is also considered as Sadyo Pranahara Marma and it comes under Sandhigata Marma. It is a seat of Indriyas, Buddhi and Manas. Governs Pranavayu, responsible for higher control of body functions. Its functional significance goes like this. It controls sensory perception, that is hearing, vision, smell, taste, touch. Regulates motor activities and coordination, responsible for consciousness, memory and cognition. Maintains integration of body functions. Modern physiological correlation. It corresponds to the central nervous system and comprises of brain and spinal cord. Process sensory input and motor output. Regulates autonomic functions, that is respiration, heart rate and BP. It controls higher mental functions like thinking, memory and decision making. Its applied importance is injury to Shira, it leads to loss of consciousness and death. Its important role in neurological disorders, stroke and head injury, essential for coordination and survival. Applied physiology of Basti. Basti is one of the three marma and is again included under Dasha Pranayatana. It is considered as Sadyo Pranahara marma and it comes under Snayugata marma. It is a main site for storage and excretion of mutra, plays a key role in maintaining balance of dosha and body fluids. Its functional significance goes like this. It is responsible for collection and elimination of a waste fluid, maintains body fluid balance, that is Jala Mahabhuta dominant, supports proper functioning of Apana Vayu, helps in maintaining internal homeostasis. It corresponds to the entire urinary system, that is kidneys, ureters and urinary bladder. Formation of urine, regulation of fluid and electrolyte balance, maintenance of acid-base balance, excretion of metabolic waste products are the functions of this basti. Clinical importance. Dysfunction leads to urinary disorders, fluid imbalance and renal failure. This injury to basti leads to serious or fatal consequences. Important in understanding Mutravasosis disorders, systemic homeostasis. At last, integrative view that mutra formation and excretion leads renal physiology. Apana Vayu helps responsible for excretory regulation mechanism. Basti acts as a key organ for waste elimination and internal balance. At the end, the conclusion comes here as these are the marmas are known or are important in the field of surgery, injury prognosis and therapeutic application. Thank you. And these are the references.
Thank you, ma'am. The time taken is 5 minutes 31 seconds, and the session is open for discussion. I request the judges.
What the new message you want to give?
Sir, actually, one should know the proper anatomy. These are the anatomical sites. Marmas are considered the anatomical sites. One should take care of these as the prana resides in these abode systems.
So now, according to the slides and your explanation, all the things are known things you explained. What is the take-home message that you want to deliver here?
Sir, at last I concluded like that. So these are the anatomical distributions which help in the surgical aspects to avoid structural and functional damage to those sites and injury prognosis and in therapeutic applications processes. Like we should consider these marmas.
Okay. Thank you.
Sir has asked a really nice question. What extra you have told? It is already known to all of us. So, with this presentation, what new you want to tell? presentation is good, and whatever the content you have contributed, that is good. But the extra research or extra thing that should be added here, like the importance what already Samhitas they have given. So how we can को प्रूव करेंगे या फिर कैसे उसको रिसर्च में लाना है, दैट इज इम्पोर्टेंट. ओके,
Judges, do you have any questions?
Yes, Aishwarya. I think it was a very fundamental level of approach. I think as a PG student, you have to go for more of detailed physiology. You could have studied the inter relation between the organ functionings, like how Basti, Hridaya, all these are interconnected. I think such level of approach would make the presentation much better. As a PG scholar, I think you have to go to next two steps ahead, where you have to correlate not only to physiology but also to pathophysiology and their probable applications, what you see in different diseases. I think this could be your next step, what can be expected in other presentations. Okay, thank you.
Okay, thank you, ma'am. Our next participant is Dr. Priya NK.
Yes, sir.
Are you ready, ma'am?
Yes, sir. Yes, sir.
Okay, your time starts now.
Good afternoon, one and all. Myself, Dr. Priya NK, Assistant Professor, Susrita Ayurveda Medical College and Hospital, Bangalore. Here I am presenting the topic Effectiveness of Bakuchi Rasayana Therapy in Psoriasis, a case report. Next. Psoriasis is an immune-mediated disease which is genetically determined. There is neither a vaccine nor a cure for this, and the prevalence worldwide ranges about 2%. The Rasayana therapy is the best choice of therapy in the chronic conditions, and it helps in the rejuvenation at the cellular level. This is the best immunomodulator, and coming to a choice of medicine, Bakuchi will be an ideal choice. Next. Case details. 61-year-old male came to the OPD with itchy, scaly lesions all over the body since 12 years. He was presenting with intense itching and mild burning sensation in the lesions, and there was also bleeding spots noted in the forehead region. Next. The integumentary system examination showed the site of lesions were all over the body with irregular shape, varying size and merged borders. The color was silvery white and blackish brown in color. On palpation, it was hard, rough, raised lesions. Candle grease sign, Auspitz sign, Kopner's phenomenon was positive, and also Voronov rings were present. Next. The Shodhana Chigilsa was adopted first, starting with Takrapana, following with Snehapana, Virechana, Nasya, and Raktamoksha, and afterwards, next, Rasayana therapy was adopted. Before the Rasayana therapy, Haritakyadi Shodhana was done using Haritakyadi Churna, 30 gram in hot water, and 6 Vekas were obtained. Yavabhojana was followed afterwards, and this Bakuchi Rasayana was prepared, that is, Bakuchi was collected and authenticated from the Arivaidishala Kotakil, and afterwards it was washed, sun-dried, and filtered. It was mixed with it was powdered and it was mixed with equal quantity of jaggery and kept in a mud pot that was anointed with ghee. This pot was kept in Dani Rashi for 7 days and afterwards it was taken out. Next. Administration. This dosage Bakuchi was given to the patient from a dose starting from 6 grams and slowly increasing the dose up to 25 grams for a duration of 30 days, and Anapana was chosen as hot water. Strict diet regulations were also adopted during this particular time. Next, please. The effect of therapy. The PASI score decreased from 14.5 to 4.8 after the treatment. Next, please. These are some documentation, a photographic documentation of the particular case that is done before treatment, and after follow-up. Next, 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 next. So moving on to the discussion. Psoriasis is a Vata Kafaja Kushta condition which is having deep-seated Dhatu Visheshan, and the prognosis is Yapya. We all know there is Bahudosha Dushti in this particular case, and there is an immune-mediated reaction that is happening. So Bakuchi, as in Bhava Prakasha, it has been said that it is indicated in particularly in Kafavada condition. This was being chosen. Next. The Soraya caudalifolia, when you look it into, coumarins, flavonoids, and benzofurans that is present, is having anti-inflammatory, antioxidant, and also antibacterial action. Next, please. This anti-inflammatory and antioxidant action of these compounds help in the reduction of the oxidative stress, resulting in the inhibition of the pro-inflammatory cytokine release, and thereby it helps in the inhibition of the T cell activation and dendritic cell activity. These all will reduce the inflammatory inflammatory response, and also it will break the chronic immune-mediated loop. So I can conclude like Bakuchi Rasayana therapy is effective in the management of psoriasis. Next, please. These are the few references. Thank you.
Thank you, ma'am. And the time taken is 4 minutes 30 seconds. And the session is open for discussion.
Madam, this Bakuji Rasayana is a drug of choice of yours practice.
Yes, sir. Actually, this was chosen because we do use Balataka Rasayana, Tuvaraga Rasayana, etc. Sir. So we wanted something that is very simple to prepare and also which is very much patient, coming to the patient perspective, which is very much acceptable. So we digged into the like different formulations, and Ashtanga Sangraha, Uttarasthana, that is in the Rasayana Vidhi Adhikara, the second, the Dvidiya Yoga is this one. So it is very easy to prepare and very much palatable to the patient. So this was chosen, sir.
Okay. The time management is good. The topic you selected is also good. And the photography you have shown in the PPT with these are the indicative parameters that you have more faith on Bakuchi.
Yes, sir.
And another thing, I don't know I have to say or not on this platform. Your voice is very good and audible. And you, I think that when you are presenting that, I am hearing something radio talk like that.
Thank you, sir.
Okay, madam. Good topic it is.
So one more thing I got, as an add-on benefit was that this patient was suffering from chronic constipation. He was relieved of this condition also by the end of this Rasayana therapy. So this was like an add-on benefit we had got from this particular case.
Yeah, because Bakuchi is Vata Kapahara.
Yes, sir.
And Pitta Vardaka.
Yes, sir.
Thank you. Thank you.
Thank you, sir.
Congratulations, ma'am. It was really nice presentation.
Thank you.
And very confidently you have presented.
Thank you, ma'am.
Congratulations.
Thank you.
Priya, indeed it was.
Congratulations, yeah, ma'am.
Yes, ma'am. Go ahead.
Okay, ma'am, please. Please go ahead, ma'am.
Yeah, indeed, it was a good presentation, Dr. Priya. I just wanted to know whether you, like, you had gone for any investigations after Rasayana or before Rasayana?
The basic investigations were done, ma'am, like CBC, lipid profile, those things were investigated. Other than that, psoriasis specific investigations were not done, ma'am.
Immunological
ESR was not done.
investigations were
Yeah.
not there. Any
No, ma'am.
immunological investigations?
No, ma'am. We hadn't gone for that, ma'am.
That would have been better. I
Yes,
just suggest that in further cases, you just go for an immunological investigations, so that you'll have a full-fledged proof for that Rasayana has acted on this levels also.
Yes, ma'am. Yes, ma'am.
Yeah?
Sure, ma'am. I'll consider that, ma'am. Thank you.
Yeah, Priya ma'am, it was a wonderful presentation from your side.
Thank you, ma'am.
And ma'am, can I know the duration of Bakuchi Rasayana for good effect?
Yes, ma'am. In the Ashtanga Sangraha, the sloka itself said it is Masam Egam Premjida. So 1 month is the duration that has been said, and we have given for that much duration, ma'am. So the dose also, it is like 6 gram we have started. That is 3 grams it will be like Bakuchi, and 3 grams it will be the Guda. So we have increased the dose to 25 gram. That is 12.5 was the maximum dose that was given to the particular patient.
Ma'am, is this indicated in Pitta Prakriti person?
No,
there must be
no.
some indications as per Dosha Dusya, right?
Yes, ma'am. When it comes to Bakuchi Rasayana, as sir was also mentioning, it is like Vata Kafahara, and it is having the fruits of Bakuchi. It is said in the Bhavaprakasha, it is Pitta Vardhana. So it is generally not indicated in the Pitta Pradhana conditions. And as I have chosen the disease as this psoriasis, which is Eka Kushta, which is having Vata Kafaja predominance, I have gone for it. And there were like mild burning sensation in the initial phase of the when he was admitted, and also the bleeding spots were also there. It was the pitta factor was corrected by the Shodhana therapy itself. And afterwards, during that time, it was only Vata Kafaja that predominant.
Okay. Ma'am, so do you think only Haritakyadi to the Shodhana is enough, or should we go for complete Virechana? What would be the better option?
Ma'am, I am an MD in Panchakarma from Kottakkal. So I would always say we have to go for Shodhana. When we are going for a chronic diseases, when it is like a Bahudosha Dushti is the always Shodhana must be preceded before Rasayana. And when it comes to Rasayana therapy, we have to go just even though the Shodhana is completed, we will have to go with the Haritakyadi Shodhana and also Yava Bhojana for Purana Chakrat Shuddhi. Then we have to go for the Rasayana therapy. So this will be an ideal protocol, na?
Okay, okay, very beautiful. Yeah,
thank you.
Yeah, very beautifully explained.
Thank you, ma'am.
Yeah, I thank Priya ma'am. It was a good presentation. Now we will move on to the next participant. We have Dr. Prajwali C. Are you ready, ma'am?
Yes, sir.
Okay, your time starts.
Good afternoon, everyone. Honorable Chair, Chairperson, distinguished faculties, respected colleagues, a very warm welcome to you all. I am Dr. Prajwali C, final year PG scholar from Department of Roganidana. Today, I bring before you today the topic I bring before you is the integrative diagnostic approach to Vandyatva, female infertility, an Ayurvedic and modern perspective, which is approached not just through the modern lens of follicles and hormones, but through the integrative wisdom of Ayurveda. Next slide. Vandyatva is from the Sanskrit word bandya, which means the one who is barren. This is a crucial condition because 1 in 6 couples globally struggle with the infertility, and 50 cases involve the female factors. In India alone, 27.5 million couples face
Excuse
this
me,
challenge.
We are not able to hear your voice clearly.
Now, sir, can you hear me?
Yeah, it's
Am I
still
audible, sir?
have glitches, I think so.
Can you hear now?
Hello?
Am I audible, sir?
No, I'm still not. I think she might having any internet glitches, so we can move to next participant.
Am I audible now, sir?
Ma'am, can you
I think you're
present
audible,
later,
ma'am.
ma'am?
A little bit.
If you have any internet glitches, so that you can fix for a while.
Okay, sir.
Okay, our next participant is Farrao Patil.
Watch.
PPT. Hello, PPT.
Okay, sir, your time starts now.
Good afternoon, everyone. Myself, hello. I am not able to see it now. Good afternoon, everyone. Myself, Apara Patel, second year PG scholar from Department of Cell Tantra, SDM College of Ayurveda Hospital Research Center, Udupi. Next. Today, I'm going to present the management of TEO as clinical case study. Introduction. TEO is a non-atherosclerotic inflammatory disorder involving medium-sized and distal vessels, which is seen only in smokers and tobacco users. It usually starts in lower limb. Upper limb involvement occurs only after lower limb is diseased. In Ayurveda, Sushruta is considered as one among the Vata Rakta Vedi, classified in Mahavata Vedi as a separate disease. According to Acharya Sushruta, the symptoms are Sushibhairava, Nishvaras, Parsudesa, Shosha, Prisuta, and Pitta Vikara. Here, the object is to understand the management of Vata Rakta with special reference to TAO. Next. Case details. Next. Histopathology illness. A male patient of age 65 years old, known case of hypertension and ischemic heart disease, not known case of type 2 diabetic mellitus. Yet surgical history of angiography in 2018 was apparently held 2.5 months ago. The patient complained of non-healing ulcer on the left fourth toe since 2.5 months, associated with pain and burning sensation in the foot region. The character of the pain is frequent type and burning in region. The pain aggravates on walking and lying on position and get relief on hanging the foot down. The pain aggravates on walking and get relief after taking rest. On lying down position, the pain aggravates, which is aching in nature and remains continuous for 45 minutes, and the pain gets worsened during night hours. The patient also complains of giddiness during severe pain. There is no history of numbness, tingling sensation, fever, nausea, and vomiting. The severe of the pain is mild to moderate. So for the above mentioned complaints, patient visited to our hospital. Next. Hello, next. Clinical findings on inspection. Ulcer over the left forefoot, discoloration absent, edema is absent, small swell is present, slough is present, but there is no discharge is apparent, brittleness present in bilateral lower limb, thinning of the skin present is bilateral lower limb, Burger postural test is negative, diminished growth of hair is present in bilateral lower limb, gross leg test is negative, thinning is present in bilateral lower limb. Next, pulsation, temperature not raised, normal, tenderness present at the left foot that is mainly on the distal part, induration is absent, pulsation, dorsal pedis artery stable, bilateral, grade 1, anterior tibial artery, bilateral, normal, grade 2, Posterior tibial artery, left side it is grade 1, that is feeble, and normal at grade 2. Popliteal artery bilateral normal, that is grade 2. Capillary fill time increase it's at left foot it is increased, that is 8 seconds, and normal is the right foot, that is 4 to 5 seconds. Venous filling time bilateral it is normal within 3 seconds. Crepitus was absent. Next, diagnosis. We diagnose this type of Vata Shohita, that is TAO, that is thromboanginitis obliterans. Investigations there, HB 11.1%, FBS was 104, and CPBS was 120, which is in normal limit, and KC and DC were within normal limits. Treatment. We plan for the treatment under rapid admission for 7 days. The summoners were Kaishara Bogulu, 1 TID was given, Gandha Karasana 450 mg of 1 TID was given, Mansadik water 4 teaspoon, that is 20 ml BD was given. All the 3 seminal medicines were given after food. Shodhana was planned. Basti was the Shodhana which we were planned. That was Manchadi Shara Basti and Matra Basti with Balataila. Daily dressing was done, where cleaning with Usol and hydrogen peroxide and packing with Jate Tela was done. Next, result. Significant improvement in ulcer healing is observed, where false smell, slump, and burning sensation was absent, and granular tissue was noted within 7 days of treatment. Where you can see in the day 1, the claudication was aggravated after 100 meters of walking. The rest pain was 45 minutes. Burning sensation was present. False smell of the wound was present. The VAS scale was 8 by 10. Day 2, there was no significant change. Day 3, we can see the change that was there was no claudication during climbing stairs. The rest pain from 45 minutes to decreased to 30 minutes. The burning sensation was reduced. It was only the burning sensation was only during the dressing hours and night hours. The false smell was absent, and the VAS scale was from 8 by 10 to 6 by 10. Day 4, there was the same. There was improvement in the symptoms. Day 5 and day 6, where we can see the absent in the intermittent claudication. Rest pain was 20 minutes. Burning sensation was absent. False smell was absent, and VAS scale was 5 by 10. At the end of the treatment, day 7, the claudication was absent. Rest pain was from 45 minutes to 10 to 50 minutes. Burning sensation was absent. False smell of the wound was absent, and VAS scale was from 8 by 10 to 4 by 10. Next, we can see the picture, where the picture was taken from the day 1, where you can see the ulcer, that stage of extension, where we have 3 stages of ulcer. First one is stage of extension, where the ulcer at the fourth to left foot, where the slough is present, scar is absent, shining of the skin is present, where there are no growth of hair over the dorsal foot. We can see the brittle nails and false smell of present. We can't identify the false smell here. Next day, on day 3, where you can see the stages of transition. False smell of absent.
Sir, the time is up. Please do conclude.
Next, day 7, that is the stage of repair. Red crimson tissue at center, blue zone, and white zone. We can see the fibrosis of the tissue. Next, discussion. Formulation for Kaishara Google, Gandha Karsana, Manchadi Pata Jata Tela. Kaishara Google, which could the Varnasaka, Kustanasaka, Shotahara, and Gandha Karsana, which is the Kustagna, Rakashodaka, and Ursana, Manchadi Pata, which is the Vatarka Vinasana. Jati Tela was used for dressing, which is the best in Runa Ropana, Shodan, and Vedan Nasaka. Next, conclusion. Occlusive TAO, the occlusive peripheral vascular disease caused due to Rakadrushti and Visheshana Padavasana. Properties of blood are similar to Pitta. Therapeutic basti is considered best in treatment of Vata Varna, Vata Vedi, that is Vata Rakta. In this case, therapeutic basti, that is Manjate Shara Basti, helps in removing the obstruction of blood vessels and helps in eliminating the aggravated Pitta Rakta dosha and thus clear the path for Vata dosha. Hence, early intervention with targeted therapy was used to accelerate ulcer healing in TO by enhancing microcirculation and promoting the tissue regeneration, potentially to reducing the need for aggressive surgical intervention. Note, the patient continues to be under follow-up and is maintaining good clinical status. Thank you.
Okay, thank you, sir. The time taken is 7 minutes 10 seconds, and the session is open for discussion. I request the judges to have the questions, if any.
No questions from my side.
Dr. Apparao?
Yes, ma'am.
Can you go to the slide where you have shown all the symptoms? Yeah.
Here, the patient complaint of non-healing ulcer on the fourth toe, ma'am. The pain is the patient complaint of pain and burning sensation. The pain is pricking type of pain and burning type of pain. The pain usually get aggravated on walking. That is, we can consider it as intermittent claudication, and the pain can keep on
What was
hanging.
the investigations done?
The investigations were done. Hemogram was done, and FBS KPBS was done, ma'am.
Didn't you go for any USG color Doppler of the arteries of the limbs?
Doppler study was done, ma'am.
Doppler study was done?
Doppler study was done, ma'am. The Doppler study showed biphasic flow in the dorsal pedis artery.
Did you show that here?
No, ma'am. They are not uploaded the Doppler study, but it showed biphasic flow.
What was the staging there?
Which, ma'am?
In Doppler study, there will be stages for this, right?
It showed mild peripheral vascular diseases, mild to moderate peripheral vascular diseases.
Okay. So, was there any necrotic changes also there? In that,
no, ma'am. There was no Easter, ma'am. There was no necrosis of the skin.
Okay. So, what is the post-treatment? What changes did you see post-treatment?
The patient is still under the follow-up, ma'am. We can see there is no slough, there is no pulse smell, and the claudication has been decreased. There is no burning sensation in the ulcer.
Okay. And the medicine plant is Teshwara Kukulu along with
Gandhakrasana Manjishadipata.
Rakta Shodhakas.
Yes, ma'am.
Basti, you said.
Manjishadi Shara Basti and Matra Basti with Balataila.
Okay. Yeah. Good effort.
Thank you.
Dr. Aisha, ma'am?
No questions from my side.
Okay, thank you, doctor.
Thank you.
We will move with our leftover participant, Dr. Prajwali. Am I audible, ma'am?
Yes, sir.
Audible, ma'am? Audible. Hello?
Hello, sir. Am I audible, sir?
Yeah, ma'am, you are audible. Can we start, ma'am?
Hello, sir.
Can we start, ma'am?
Yes, sir.
Okay, your time starts now.
Good afternoon, everyone. Honorable Chair, distinguished faculties, and respected colleagues. A very warm welcome to you all. I am Dr. Prajwali, finally a PG scholar, Department of Roganidana. The topic I bring before you today is integrative diagnostic approach to Vandyatva, female infertility, an Ayurvedic and modern perspective. An approach not just through the modern lens of follicles and hormones, but through the integrative wisdom of Ayurveda. Next slide. The word Vandyatva is from the Sanskrit word Vandya, which means who is barren. This is crucial because 1 in 6 couples globally struggle with infertility. 50% of the cases involve female factors. And in India alone, 27.5 million couples face this challenge. Yet we are still often treating the symptoms rather than the root causes. Vandyatva, according to Sushruta Samhita, is the loss of Artava, not just a menstruation, but the capacity to conceive. WHO defines the infertility as the failure to achieve the pregnancy after 12 months of unprotected intercourse. Today, the Ayurvedic and modern perspective together give us both the why and the precision of the diagnostics we need. Now we'll see the Garbha Sambhava Samagri. For the conception to occur, four factors must align. First is Ritu, the correct timing during the fertile window, and Kshetra, the healthy, receptive female reproductive tract, Ambu, proper nourishment through the good nutrition and hormones. And lastly, which is important, Bija, healthy gametes from both the partners. These factors, collectively called as Garbha Sambhava Samadhi, any disturbance even in one factor causes infertility. This framework immediately tells us where the diagnosis must focus. Now we'll see the other causes. Vandyatva isn't just one disease, it's a syndrome. It can arise from the menstrual dysfunction, vaginal disorders, structural problems, Rajodushti, Yoni Vyapat, Yoni Ashra, Maithuna Asaishnuta, and local conditions like Raktagulma, Arbuda, and general conditions like Raja Ishman, Shosha. Charaka even noted that intercourse with a psychological disturbed woman or with an digestive disturbed woman becomes futile, showing that ancient physicians understood the mind and body connection in the infertility. This diversity of causes demands an integrated diagnostic approach. Next slide. Now we'll see the types of Vandyatva. Charaka classifies infertility to three: Vandya, Apraja, and Sapraja. And Arita offers 6 types, that is Balya, delayed puberty, Balya, delayed puberty, Kakavandya, one child's sterility, Anapatya, primary infertility, Garbhasravi, that is repeated abortion, and Mritsvatsa, that is stillbirths, and Balakshaya, due to the Dhatukshaya. These classification guide our prognosis and treatment selection. A woman who is healthy, already conceived, as a different outlook than the one who never has. Now we'll see the Trivida Pariksha in Vandyatva. Ayurvedic diagnosis uses the threefold examination method. That is, first is Darshana, general appearance. We can examine general appearance, Staulya, Kashya, and signs of hormonal imbalance, that is hirsutism, acne vulgaris, and acanthosis nigricans. And in Sparshana Pariksha, we can examine per abdominally, that tenderness, uterine size, mast or cyst, that is correlated as a granthi. And in Prashna Pariksha, we can ask for menstrual history, coital history, duration of infertility, diet and lifestyle habits, and manasika factors like stress and anxiety. Next slide. Now we'll see the integrated diagnostic assessment. This is where we integrate both the systems. Modern tools gives us the precision about the hormonal panels, imaging and metabolic assessment. Ayurvedic tools gives us understanding about the individual constitutional assessment, dosha diagnosis, and tissue quality evaluation. Together, we don't just diagnose the disease, which is what's wrong. We understand why it is wrong in this patient. A woman with a normal FSH but poor digestion needs nutrition and metabolic correction rather than gonadotropins. Next slide. Now we'll see the Shrotas involvement in Vandyatva. Different reproductive problems arise from the different channels, channel of obstructions. These are the Shrotas involved in the disease causation. Artavaha Shrotas causes ovarian and uterine pathology. Rasavaha Shrotas causes nutrition-related infertility. Raktavaha causes excessive bleeding and anemia. Metavaha causes PCOS and metabolic syndrome. Manovaha Shrotas dysfunction causes stress-induced anovulation. And Udakavaha Shrotas causes dysfunction. Udakavaha Shrotas dysfunction causes the thyroid and hormonal imbalance. When your patient's investigation is unexplained, look at all the Shrotas, and the answer may not be in only Artavaha Shrotas at all. It may be in our gut, in our mind, in our thyroid, or in our metabolism. Next slide.
And the time's up.
Now we'll see the psychoneuroimmuno axis in Vandyatva. The mind is profoundly affects the fertility. A woman with a sattva nature will be having a clarity and emotional resilience, maintains the optimal ovulation. A woman with a raja nature having anxiety and excessive activity expresses stress-induced anovulation through the elevated cortisol levels. A woman with Tama nature will be depressed and lethargic, which has a hypothalamic suppression. The stress pathway is a neurobiological. The stress triggers the corticotropin releasing hormone, which suppresses the gonadotropin releasing hormone, which in turn suppresses the FSH and LH, resulting in anovulation. Stress doubles the risk of IVF failure. Mental and emotional assessment is as crucial as the hormonal assessment. Next slide. Now, I would like to conclude that Vandyatva is not a single disease but a complex interplay of the multiple factors. Ayurveda provides a deep individualized understanding of the root cause, while modern diagnostics offer precision and validation. An integrated stepwise approach leads to the accurate diagnosis and better clinical outcomes. We are not just treating a disease, we are treating a woman. A Sanskrit phrase says that Srihi Sampurnam, woman is complete in herself. Our role is just to help her restore her balance. Next slide. These are the references. Thank you.
Thank you, ma'am. The total time taken by you is 7 minutes 30 seconds. And the session is open for discussion.
Go to the last slide, please. Last but one, discussion slide. Discussion slide. Still back. Still back. Yeah. So, can you elaborate, madam? Rasavaha Srotas with Vandyatva? Rasavaha Srotas with Vandyatva.
It causes nutritional related dysfunction.
Nutritional related?
Sir?
Rasavaha Srotas impairment leads to Vandyatva. Elaborate it. You said that multi-dimensional Srotas-wise approach has to be made to diagnose the Vandyatva. It is not only related to the Artava Srotas, right? So I am
Yes, sir.
asking Rasava Srotas causing Vandyatva. How?
Rasavaha will provide the nourishments to the further dhatus, and imbalance in that may cause the infertility, Vandyatva.
In Rasava Srotas, the Rasadhatu itself, there is an answer.
And
Not all.
it is like Artava is like Upadhatu of Rasa.
Okay. It is only related to the, what you call, the Vandyatva, or as the others too. As like
Other in the
Asti Dhatu, Asti Dhatu,
yeah,
or
yes, sir.
Astiva Srotas.
Like
Astiva
Dhatu Poshana
Srotas, how
Nyaya.
it yes, Astiva Srotas, how it causes Vandyatva.
Like I have not mentioned about Astivaha Shrutas.
You mentioned that all the Srotas, the same sentence I am explaining to you, reverse back, that only the Atava Srotas is not affected in the Vandyatva. Multi-dimensional approach or diagnostic has to be done in consideration of all the Srotas. So that's why I'm
That is
asking
like
about Astiva.
that is Artavaha Shrutas, Rasavaha Shrutas, Raktavaha, and Medavaha, Manovaha, and Udakavaha Shrutas, sir. In like only we can't see the Artavaha Shrutas pathology because pathology is like beyond that. It may be in our gut, in our metabolism, in our mind, like mental stress may lead to Vandyatva. And our thyroid problems also may lead to Vandyatva. All these factors we have to consider. Neither
Then
just
thyroid
seeing
problem
the
you are considering the thyroid problem in which Srotas?
Udakavaha Shrutas.
Why?
Uh,
Why?
Like Udakava Shrutastana is Talu Mula
See,
Kloma.
this comparison is made by you or else someone has guided.
Like after reading, I only did that.
So what is this
We can understand like that.
DIFR 5 matrix? Sattva, Raja, Tama, Manasa Prakriti, stress markers, cortisol, psychological screening. Okay, will you elaborate this? Explain the last
Right,
one.
sir.
And go Srotas involvement. As Bijacha me shrunu or Daivacha me shrunu. The concept it is explained in the Yoni Vapat.
Yes.
In such conditions, what are the screening methods? As Narashanda is there, Narishanda is there, Varta is there. Bija Dushti is different, Bija Bhaga Dushti is different, Bija Bhaga Avayava Dushti is different. So in such cases, which Srotas has to be considered? And Daivacha Meshrunu, in such cases, which type of the treatment has to be advised? What are the diagnostic criteria? How can you will assess? And you have said that hypothyroidism, it is Udakava Srotas related. How? On which basis?
Like I considered Udakava Shrota Mula is Talu and Kloma. Like the site of thyroid is also that.
Huh?
Site of thyroid, like it is that only. Udakava Shrotastana only. So I consider like this.
Thyroid, it is a gland.
Yes.
Talu?
Like Stana,
It is a
just
different
I just correlated, sir.
See, when you are correlating, you must and should justify it, right? Because the new thing what I have ignited in my mind is the multi-dimensional approach has to be made. Do not consider only the Arthava Srotas. So that's why I pinpointed that the question. Because you have given something new idea in my mind, so because I
Yes,
am
sir.
also
Like in
practicing
Rasavaha Shrotas, we can see like a nutritional deficiency. That panels we can check. Albumin, iron, B12, hormonal panel we can check. And in Raktavaha Shrotas, we can check do the investigations like CBC coagulations and liver function test. And in Medavaha Shrotas, lipid profile and insulin resistance we can check, sir. And in Manovaha Shrotas, there will be hypothalamic dysfunction, and due to this stress, it will lead to the suppressing the GnRH and FSH, further suppressing the LH hormones.
one of the will you please what you call diagnose the case? I will give one history. A lady aged about 28 years, but still she doesn't have a periods. Her all secondary sexual characters are there. Mammary glands are developed. Pubic hairs are there. Everything is there. Even though your TBC, LFT, whatever the things you have done, I have done all the things. At last, I have advised for USG. I got to know that infantile uterus. So it is a dushti of
like Artavaha Shrotas.
Arthava Srotas of that particular developing child or else her mother.
Like it may be from our mother also. We have to
No, I am
do
asking
the
you justify it Arthava Srota Dushti of mother or Arthava Srota Dushti of that developing embryo.
like I feel it is child's only, sir, because of the obstruction.
See, when
Polycystic.
Moolasthana, it is explained, it is in consideration with the anatomy, it is in consideration with the physiology, it is in consideration with the pathology too. But you explained that multidimensional approach has to be made Do not consider a single srotas. Of course, you are right, but it doesn't mean that it will be there in all the cases. So that's why I'm asked the justification for you. Anyhow, the good topic, good interpretation you have made. Thank you.
Prajwala?
Yes, ma'am.
Yeah, it was a good presentation. I think such innovative thinkings are required, and this will initiate more and more thoughts. Yeah, no comments from my side as such. But as Sir said, I think it can be beyond this, whatever we have mentioned, you have mentioned, it can be sometimes beyond also. There are many more causative factors, congenital anomalies and all, so which you can include next time. So, yeah, thank you for me.
Thank you, ma'am.
Hi, Prajwala. It was nice presentation and good collection also. So, it was nicely
I can't hear you, ma'am.
Is it audible?
Like it is
Hello.
breaking, voice is breaking, ma'am.
Now is it audible?
Yes, ma'am.
Okay. No comments from my side. It was a nice presentation. Okay.
Thank you, ma'am.
No.
Thank you, sir.
Thank you. And with that, we have concluded all the individual presenters for today. And at this point, I would like to invite Dr. Saurabh Kukutnur, sir, Managing Trustee of TSP Trust, to address the gathering. And we request you, sir, to extend the vote of gratitude and to invite our esteemed judges to share their expert opinions and reviews on today's proceedings.
Thank you, Harshita. Namaste, everyone, respected panelists for today's presentation. Dr. Abhishek sir, Dr. Usha Sanu madam, Dr. Aisha madam, and Dr. Santrupti madam. On your busy schedule on a vacation day, still you joined with your precious time for a very long marathon of 11 presentations today. And you have assessed to the quality required to maintain the standards of international level of presentations by the scholars. I am very much grateful and I extend my warm thanks, wishes to all the panelists for their constant support with their breakthrough questions at every presentation and making critical review. Students and participants and the viewers over social media can witness that judges are not just joining the meeting through online portal and sitting working somewhere else. They are listening carefully to every presentation, and that can be witnessed by the critical questions what they raise. So it was great to have such panelists with us today, and we completed all our scientific presentations for the 2026 Tadvidya Sambhasha Parishat conference. So thank you all the panelists for your constant support and presence on your busy schedule, that too on a holiday. The whole day was consumed by this presentation. Thank you all for joining for the good cause. Thank you. Over to you, Anisha.
Thank you. Thank you, sir.
Harshita,
Thank you, sir.
over to you.
Yes, sir. I would like to invite our judges to express their view on today's presentations. Dr. Abhishekar Gone, sir.
All the presenters, they made the effort to present the cases. So few of the cases, like Dr. Vaibhav, I think he is presented regarding that Jata Harini, and the last one, all the cases are very nicely they have presented. Some new ideas we also got, because knowledge never ends, learning never stops. So we have to hear the few new ideas that the newcomers, the PG scholars, and a few of the staffs, they are also presented the topic. I'm very much thankful to the Tadvidya Sambhasha Parishat that they have given the opportunity to make the judgment of such presentation. So actually, I have given some other date, but still they told us to continue the judge for today's session. Even in my busy schedule also, I felt very happy by listening these presentation. I'm very much thankful to all the presenters also. So, and another thing, I want to share the things to the presenter, that for few presenter I have told directly that you have put all the things on the slide. You are just reading like that. And for few students, few participants, I told that you have not told anything new like that. So, being a judge, I thought or I feel that it is my responsibility to guide also. So, maybe my expression to guide is maybe not a soft one, but you consider it as a positive thing. Thank you, one and all.
Thank you, sir. Thank you so much. Now I invite Dr. Santrupti Katti, ma'am, to share her opinion on today's presentations.
Yeah, good afternoon, all. First of all, I would like to thank Dr. Saurabh Kokutna, sir, and the whole Tadvidya Sambhasha Parishat for giving me an opportunity to be a part of this panel. And coming to the presentations, all the participants were very good. The presentations were also good, and the topics were really very nice. And at last, I would like just say that it was a good opportunity for me also. Thank you, one and all.
Thank you, ma'am. Thank you so much. Now I would like to invite Dr. Usha, ma'am, for her opinions on today's presentations. Dr. Usha, ma'am.
I think she's not there.
Yes, sir. I would like to invite Dr. Aisha, ma'am, to share her opinions on today's presentations as well.
Thank you, Dr. Harita. So, thank Dr. Saurabh Kogatnur and the team of Tadvidya for organizing such a
Ma'am, we are not able to
the
hear
part
you,
of
ma'am.
hello, is it audible?
Yes, ma'am. Yes, ma'am.
Hello,
Yes,
is
ma'am.
it
Now you're
audible?
audible. Yes, ma'am. Yes, ma'am.
Yes. Okay. So first, I would like to thank Dr. Saurabh Kogatnur and the team of Tadvidya Sambhasha for bringing up such a good platform for all of us to clear the concept of Ayurveda, and I congratulate all the participants who have participated here and who have presented so wonderfully. So I feel to be honored to be the part of this Tadvidya Sambhashan. So thank you, Dr. Saurabh, and thank you, the team of Tadvidya Sambhashan.
Thank you, ma'am. Thank you so much. And I thank all our judges for their.
Harshita, just a minute. Dr. Usha Sano has joined back. Please invite her.
Yes, sir. I request Dr. Usha ma'am to share her opinions on today's presentations.
Yeah, very good afternoon to everyone. So actually, I feel very happy to be a part of this panelist group because it was a great experience listening to all the PG students as well as all the staff also. They presented so very well, and yeah, it was obviously a plus point in the knowledge, whatever people presented. So I'm very thankful to the panelists for conducting such sessions and giving opportunity to participants as well as other staff so that they can increase their knowledge, update themselves. So thank you. Thank you for all the good work. Thank you.
Thank you, ma'am. And I thank all our judges for their profound insights. And it has been a truly educational experience for all of us. And while we conclude this online session, the real journey continues at the main event. We are eagerly awaiting your physical presence at the conference to continue our explorations of Patha, Avabodha, and Anusthana. Thank you, and Namaste.